Fine.
Please,
Yes.
including those in the room.
Would have worked.
Meeting will come to order. I'd like to say that the meeting has been duly advertised as a public meeting in accordance with the Sunshine Act and is therefore open to members of the public as observers. Participation in the meeting is limited to trustees and to those the trustees have invited in advance to take part in the meeting. The meeting is being recorded and the minutes from this meeting will be available on the trust website after they are approved by the Board of Trustees. The executive session was held today, immediately prior to this public meeting, for purposes of receiving litigation updates and legal advice, and all of this is in accordance with the Sunshine Act, and which I'm happy to say. With that, we will get started. Could I have you circulated the minutes of the February 8th meeting, which of the public meeting? They were circulated to the trustees. Could I have a motion to approve those minutes?
So moved. Captain Boozle.
Okay, is there a second?
Second.
Any discussion or correction? All in favor, please say aye.
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 Opposed?
Aye.
Opposed? Hearing none, the meeting minutes of the February 8th meeting are approved. With that, we are going to move on to the Wave 2 settlement updates from the Pennsylvania AG's office. Tyler Ritchie, I believe, is going to present those updates on the Wave 2 settlements.
Yes, good morning. Two quick updates on the Wave 2 opioid settlements. The first is that the Commonwealth Court has approved the consent judgments for the Wave 2 defendants. That makes all 5 settlements a order of the court and therefore enforceable. The next steps for the AG's office is to move to consolidate all of the Wave 2 settlements with the original Wave 1 settlement into kind of one action and then move to amend the trust order. There is one hurdle that the AG's office is working on at the moment, and that is a participating subdivision has objected to the proposed allocation in the amended trust order, and the Commonwealth Court has set a hearing for that on June 26. The second update is that Philadelphia has reached an independent settlement with Walgreens and is therefore unable to participate in the Commonwealth settlement with Walgreens. This is going to result in an impact on the amount of money that's distributed from the Walgreens settlement to the participating subdivisions of about $44 million. And so the AG's office will work to create a new kind of estimated allocation for the Walgreens settlement and publish that well in advance of the trust distribution of Wave 2 settlement funds. Thank you.
And we will attempt, if we can, to have an update at our June 20th meeting, which will be the next public meeting of the trust, so that further questions can be asked once you get some of those numbers refined, Tyler. Does anybody have any questions of Tyler relating to the Wave 2 settlements or any of the things he discussed? Okay, hearing none. Tyler, thank you very, very much for the update. We'll look forward to it. Obviously, this is going to be additional monies that will be distributed this year and a not insubstantial amount of money. So we will look forward to hearing the report. With that, I would like to move on. First of all, I'd like to introduce Brianna Anderson, who is a new employee of CCAP and will be working with us going forward, and not totally replacing Heather, but I would like to thank Heather for all of her service and everything you have done, Heather. It's been invaluable, and we really appreciate all of your efforts. Bree, welcome on board. You've been here for 3 weeks and you haven't left yet, so hopefully that means that so far you're liking what you're seeing. What it is going to necessitate is that we do have to add Bree to our trust bank accounts. There was a motion in the material that was circulated to you in order to do that. So I would like to have a motion to the effect that resolved that the Board of Trustees hereby authorizes Thomas Van Kirk, Heather Heister, and or Brianna Anderson to act on behalf of the trust in relation to any accounts at Wilmington Trust, provided that neither Heather nor Bree may be signatory on any payment for the benefit of CCAP. Nothing in this resolution shall alter any of our prior resolutions relating to other people that we have made the trust account available to. Further resolved that the Board of Trustees hereby authorizes Thomas Van Kirk, Heather Heister, and Brianna Anderson to act on behalf of the trust in relation to M&T Bank. Many of us view them as the same, but there are separate accounts at M&T and Wilmington Trust. So may I have a motion to that effect?
Make
So
motion.
move.
Okay,
Senator Tartaglione,
Senator Tartaglione, and the second was
I believe it was Dr.
Dr.
Wright.
Wright, second.
Dr. Wright. Thank you very much. Any discussion? All those in favor, please say aye.
Aye.
Opposed? Thank you very much. Okay, now we'll move on to what the meat of the meeting is. And why so many of you, I'm sure, are on the phone today. You'll recall it was the Commonwealth Court order, which was entered into in July of 2022, which required the counties to submit a report to the Board of Trustees by March 15th, showing actual expenditures of trust funds and the amount of trust funds received but not spent by the close of the previous calendar year. Litigating subdivisions, I hasten to add to that, were not part of the Commonwealth Court order and therefore were not required to, but in the case of some of the litigating subdivisions and particularly some of the DAs, they voluntarily submitted programs. We are not going to be reviewing those today because of the fact that they were not required to, but we are seeking clarification in future Commonwealth Court orders to have the litigating subdivisions likewise be subject to the same requirements as the county. So with that, I am happy to say that as of March 15th of this year, all 67 counties and some of the litigating subdivisions did submit reports to the trust. And in fact, in the case of about 2/3 of the counties, they had submitted them even earlier and submitted them in February. I think it is very telling as to how seriously the counties took this, that they did in fact get their reports in, and we did not have to chase down the counties. And it's to their credit that they stepped up to the plate. I would also say that their job was made somewhat easier by virtue of the fact that they were submitting reports on their specific programs, that on reports that were submitted to a reporting tool that was developed by Penn State, Pitt, and Temple, and that helped them to fill out the questionnaire. It was invaluable. It has all been reviewed by Penn State, as you probably would figure that as in the case of any first effort at something, as the work groups went through all of these, we did find that there's going to have to be tweaks to the reporting tool to clarify the information we're seeking, and to, in the future, clarify what had been approved and what are new programs that need to be approved. So all of those tweaks are going to be made, and educational programs will be held by Penn State, Pitt, and Temple in order to try to make it as easy and as little an administrative burden as possible on the county. But the work that they did and the reporting tool that they developed was invaluable to us. And I'm happy to say that what they reported was that approximately 370 programs were submitted that show monies either spent on or committed to the opioid remediation program. So a tremendous number of programs. It shows a lot of work on behalf of the counties, and obviously it created a lot of work for us in going through and reviewing these. But pursuant to the court order, the Board of Trustees is to review these and to ensure compliance with the settlement terms, primarily that the money was spent in accordance with Exhibit E. Exhibit E, you might recall, was the exhibit to all of the settlement agreements that Pennsylvania entered into with the defendants. In this case, for the most part, the defendants were the three distributors that we've talked about numerous times, and also J&J. They all had to agree in order to get funds that they were going to abide by the terms of Exhibit E, and it is our job to make the determination as to whether or not we believe the counties did in fact spend this money in accordance with Exhibit E. I would like to add at this point, it was not the job of the trust to determine whether or not we would have spent the money that way. It is not the job of the trust to tell the counties how they have to spend money. It was specifically determined first by the group that got together and mediated this, that made the recommendation that the counties were to get the bulk of the money, that the decisions as to how to spend the money were going to be made by the counties and by the litigating subdivisions. It was not going to be made by the state. We were trying very hard to not create any problems that had been caused by the previous tobacco settlement, where everybody in very good faith tried to spend the money on tobacco cessation programs and research. But in fact, once the budget crisis hit, immediately the money was being spent on potholes and paving roads, as opposed to what it was supposed to be spent on. So the defendants and the states were very careful this time to create an Exhibit E to mandate what the money could be spent on, but it was left up to the county to decide exactly what the programs were going to be. The way the trust decided to approach this, and this was all reported at the February 8th meeting, and subsequently appeared on our website, is we did create 3 working groups so that the entire trust would not have to go through in detail all 360 programs. We attempted to divide up the counties so that each of the 3 working groups that we created would have by population approximately 4.6 million individuals in their working group. So the number of counties in each working group may have varied, but I can tell you that the population addressed by each of the working groups was approximately 4.6 million in population of the different counties. Each working group did in fact receive and work through well over 100 programs each. Perhaps, Dennis, I see you sitting there with a book. If you could hold up your booklet, I think that represents one working group, and there were 3 such binders, and all of the information that the counties had submitted were given to each working group and for the counties that they were to review. Working group number 1 was comprised of Commissioner Bosel, Commissioners Postal, Secretary Tay, Senator Tartaglione, and Dr. Jean Wright, and they met on April the 11th and the 29th in order to review the programs that had been assigned to them. Working group number 2 met on April the 12th and April the 29th, and I would say that each of the first meetings of these groups each consisted of 5 hours of meetings to go through these, as well as working group number 3. They were all 5-hour meetings, and we used almost every minute of each of the 5 hours to go through the programs that were assigned to them. But as I said, working group number 2 met on April the 12th, April the 29th, and consisted of Secretary Davis Jones, Senator Rothman, Commissioner DiGirolamo, and Senator Mark Rossi. Representative Mark Rossi. The third working group met on the 25th of this year and consisted of Shay Madden as the leader, Representative Jim Gregory, Aaron Dalton, and Steve Jasper. As the chair of the board, I participated in each of the meetings, as did CCAP and as did counsel to the trustees. We wanted to provide some continuity and also have counsel to answer if anybody had any questions as to what may or may not be included within Exhibit E. I do want to provide a little bit more clarity on the process and our next step. We do intend at this meeting to go through in alphabetical order with each of the counties. We don't want any working group to have to go on for an hour and a half at a time. So we are going to go through the counties by alphabetical order, and the working group chair will present what its recommendations are. We encourage full discussion by the trustees as if they have any questions at all, and then we will move for approval of where we are recommending the approval of these. We will recommend the approval in groups of about 30 or so, so that we don't have to be taking a full vote every time that we deal with every one of 360 or 370 specific programs. So we will now review those recommendations. Following this public meeting, and we've divided the recommendations into 3 categories. One, that we are approving it, and that's going to constitute about 55% of the programs that you're going to be hearing about today, or sending it back to the county for further information because of questions we had. We weren't totally clear on exactly how the money was spent, and we want to make sure that it was complied. And in a small number, single-digit number, we will be recommending that the program is disapproved because on its face, it does not comply with Exhibit E. If somebody wants to appeal that, they obviously can, but we think it's pretty clear that those single-digit number of programs did not comply. To the extent any program is considered to, we will seek the additional information on forms that have been developed and will be explained after we go through each of the programs. And as I would also say, the litigating subdivisions were encouraged to submit the reports, but they weren't required. And therefore, we are not going to go through any formal action today with any of those litigating subdivisions. I would also finally say that according to the trust order, the counties and the litigating subdivisions are required to spend the trust funds within 18 months of their receipt. You may recall some of the funds were dispersed in August of 2022, and those funds will have been required to have been spent obviously by now, by March 15th of this year. Certain of the other funds that were distributed December the 15th, and it was a great bulk of the money distributed in 2022, won't have to be spent until the 15th of June of this year. So there are a number of funds that still are to be spent unless people requested extensions of time. And recognizing that they may benefit from additional timing, the Board of Trustees had previously approved a resolution to grant requests for a 6-month extension to funds that were received in September and December of 2022, and we will provide a list of those. But a number of counties did request extensions, although many times it was not needed. I will say also that the $67 million that was distributed to the counties in 2023 will not be required to be spent until 2025, in the first part of 2025, and we will be seeking additional reports at that time. So we are not requesting at this time or having discussion of the monies that might be spent. With that, we will review the program submitted. We will display a spreadsheet containing a list of the programs in alphabetical order. And I would ask that each working group leader responsible for a given county identify the program by county name, the program number that is in the March 15th report, the program name, the dollars spent, and what the working group recommendation is. As I said, I encourage everybody to have a discussion to the extent that they want any particular recommendation, and we will vote on the recommendations for approval in groups of 30 as we go along. So starting first is working group number 3. So I believe, Shay, you are on tap for Adams County.
Okay, Adams County program number 1. Program name is LOCA, OCA. Total spent and committed $73,801.78. And we classified it still under consideration, needing more information to look at it. Adams County program number 2, program name HS Coordination for $65,000, also still under consideration.
Okay, are there any questions or anybody want any further details as to, as I said, the reason most of these are under consideration, we did not receive enough information in the large booklets that you saw that were submitted in order to fully determine it, but based upon the scant information in some cases that we did receive, it appeared, and the counties did represent that it was spent on the different categories that you see under the scheduled categories on this sheet, and were worthy enough that we believe that that the county should be allowed to submit additional information. Any questions about Adams County? Hearing none, we'll move on to Allegheny County, and Commissioner Boozle, would you please address Allegheny County?
That's not my
That's-
group.
That's
Number
for
2.
me.
The secretary.
I'm sorry,
Yes.
Secretary.
Yeah. So Allegheny County program number 1, it's a naloxone distribution program. The amount a little bit over 213,000, and we are recommending approval. Any questions? All right, I'll go on to the next one. Allegheny County, program number 2, Early Head Start Child Care Partnerships Program, 905,868. We did approve that program, child care for individuals trying to access OUD treatment. If you can scroll up just a little, Allegheny County, program number 3, telehealth clinic services. The amount, 941,000. We do recommend approval. The county, program number 5, low barrier shelter. We are recommending approval. Total spent $595,554.
You're right. I'm sorry, Secretary. I scrolled a little bit too fast. Number 4, we skipped mobile MAT.
Okay, mobile MAT, Allegheny County, program number 4, mobile MAT, $579,000. That program is still under consideration. We are requesting a little bit additional information.
Okay, let me scroll down here too.
And I can tell you that one of the reasons under that was because it was a mobile program. I believe we know that the program is required to be licensed, and we wanted to make sure that the proper licensing is in place for that project. It is a state requirement that it be licensed, and you'll see that arrive in several different cases where licensing might be required.
Yes, and I think that's what we are trying to determine, depending on what type of mobile, what kind of medications are being administered. We wanted to ensure that we had the additional information. All right, we are now on, are we on number
5?
Okay,
Number 5. There we go.
All right, number 5, low barrier shelter, $595,000. We are recommending approval. Allegheny County, program number 6, student assistant programming, $147,000. We are recommending approval. Allegheny County, program number 7, contingency management. That one is still under consideration. The amount, $1.7 million. Allegheny County, program number 8, recovery housing, $181,000. That is still under consideration. Tom, I think this one was a little bit more about trying to understand the property and the ownership of the property. And so we just had some questions about.
Yes. The issue on you're exactly right, Secretary. The issue on this one was that the capital funds for the recovery housing and the wellness center was to be paid for by opioid funds. For the first 5 years of operation, the operations were going to be funded by other funds. And because the opioid funds are going for the entire life of the Jade Wellness Center, we wanted to make sure that the funding was going to be there for the operations of the wellness fund following 5 years. So we're going to go back to Allegheny County for further information on that.
Allegheny County, program number 9, emergency department outreach, $700,000. We are recommending approval. Allegheny County, program number 10, jail, MAT, $173,000. We are recommending approval. Allegheny County, program 11, syringe services programs, $325,000. We are recommending approval. Allegheny County, program number 12, the River Clinic, $348,000. We are recommending approval. Allegheny County, program number 13, training collaboration, $105,000. We are recommending approval. And then for program number 14, Allegheny County Public Education Program, a campaign, $300,000. That one is still under consideration, and I think we wanted to understand a little bit about the campaign, the use of sort of the funds or the budget or something related to that, if I can remember accurately. I think it's been well over a month. Can't remember everything.
Secretary, your recollection is absolutely correct. On this one, it's a large amount of money. You'll see this arise in connection with other counties. Obviously, educational programs and educating the public is part of Exhibit E and is certainly allowed under Exhibit E. But what we want to make sure, and the reason we're sending it back for further consideration and did with a number of other counties, when money was being spent on public education campaign, and particularly to add agencies, we want to make sure that the bulk of the funds really is being spent on for education to distribute and get the information out to the public, and it isn't just going for creative purposes and to really benefit just the PR firm or the advertising firm that might have been engaged. So we think we owe the obligation to go back and look a little bit closer at what the proposal might have been and exactly how a significant number of funds is really being spent, and to make sure that that it really is going for opioid purposes.
Right.
Okay, with that, we are finished with Allegheny County. Any questions generally about Allegheny County? Okay, we'll move on to Armstrong County, and this is working group number 1. And Kevin, I believe
Yes, that's
this one is you.
That's fine. I'll own this. Thank you, Mr. Chair. Armstrong County submitted 3 programs. Armstrong County program number 1, Recovery Center, $113,103, supporting people in recovery. It is recommended for approval. Armstrong County program number 2, Armstrong, Indiana, Clarion County Commission also engaged school salt works presentation for $1,000. It is also recommended for approval for prevention.
And Kevin, you might want to mention that you'll see a number of times SaltWorks is coming up here. This was also discussed at the County Commissioners Association meeting yesterday, and a full description made of SaltWorks, but they develop programs and present them primarily to grade school students, usually at the cost of about $300 per session. And all of it is aimed at addressing drug problems with school-age kids to try to keep them from getting addicted to drugs.
Not to correct you, but I believe it's $500 per session.
Excuse me, $500.
Thank you.
Sorry.
That's all right. I believe they had 2 sessions. That's why I know it's $1,000.
Okay.
Armstrong County program number 3, student assistance program, $25,656. It is also recommended for approval. It is prevent and misuse of opioid. That is my 3 for Armstrong.
Okay, thank you.
All right, Shay.
Okay, moving on to Beaver County, and this is working group number 3, Shay Madden.
So Beaver County, program number 1, Gateway Rehab Harm Reduction and Expansion, $552,000, $552,097.44. Still under consideration by our group. It was a lot of, couple of these programs relate back to infrastructure and purchasing of repairing facilities, I should say. So I think we wanted more information on how that would affect. Program number 2, Narcan to reverse opioids, in the amount of $78,210. We are recommending approval. Program number
And,
3.
excuse me,
Okay.
Shay, this is probably a good place to bring up, and maybe I should have under Allegheny County, which also had a similar thing. One thing we would like to note, and we're going to note to all of the counties, is some of these programs, such as Narcan, it's a proper expenditure, clearly, under Exhibit E, but we want the counties to know that the state, through DDAP, has made available, and Narcan is the perfect example, a lot of Narcan that can be used by the counties, and we want to encourage the counties, to the extent that they can get this, things like Narcan under other programs, and free up opioid money to spend on still further opioid remediation programs. We encourage them to do it. It's not that we're disallowing it, that we can't require it, but we do want people to know that there are other sources available so that they don't have to spend their opioid money on that. Sorry, Shay.
If I may, Mr. Chair, one of the comments that came out of our symposium yesterday was we exhausted that resource and we needed additional. And so
Yep.
that was their comment on at the expenditure. So just to be clear that there may be a rationale behind it.
And there probably will be in many cases.
Thank you.
Okay,
Beaver County program number 3, ABC Associate Infrastructure Expansion. Again, we have still under consideration. Program number 4, same facility, ABC Associate Infrastructure and Training Expansion. And I'm sorry, I didn't say the amount on the first one. Was $474,976. Program 4 is $32,355. We would recommend them both still being under consideration. Beaver County program number 5, OUD harm reduction program, in the amount of $43,727.40. We are recommending approval. Beaver County program number 6, DASVV infrastructure expansion. We are recommending approval in the amount of $23,080. Program, Beaver County program number 7, case management for incarcerated population, in the amount of $93,097.49. And we recommended approval for that.
okay. Any questions concerning Beaver County? With that, I think it's an appropriate place for us to vote. We're down to approximately 30 programs that we have just reviewed. And what I'm seeking approval for with the following resolution is the ones that were recommended for approval, that the trust concurred, that they can be recommended, and we can let the counties know that their programs have been approved. First resolution is resolved, the Board of Trustees of the Opioid Trust, based on recommendations of the working groups that met and reviewed the March 15th, 2024 reports from county, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, which were described and incorporated in the Commonwealth Court Order of July 12th, 2022. That would be the Allegheny County program. Excuse me.
Senator Rothman has his hand up.
Okay. Yes, Senator Rothman.
Thank you, Mr. Chairman. Prior to a vote, do we have an opportunity to make comments about the specific programs, or do you want us to do that at the end? Or I'm not going to vote no on approval, but I do want to point out that even if there are things that may be acceptable, and I know you made note of this earlier, that may not be good public policy. And I do not want to vote to support the needle exchanges. I think that's under Allegheny number 11. In the Pittsburgh Point, Prevention Point, Pittsburgh. So are we going to be able to vote no on specific projects, or we're going to do the whole resolution?
You can vote no on specific projects if you would like, if you would note it.
That's all I would like to, just to note that you know, I don't think, while I agree that that's allowable, I don't think it's good public policy, but I think that's enough, and I can vote for the whole resolution.
Okay, we note that, and we'll note the exact reasons why. I would like to say with regard to the syringe programs, and it's a difficult question, it's clearly allowed under Exhibit E, but it's also precluded by the state, and we are not encouraging anything that would violate state law. It turns out that Allegheny, Philadelphia, and maybe one other county is allowed to have these syringe type of programs under state law. And as I said, under Exhibit E, it's clearly allowed, but that doesn't mean that it doesn't mean we're encouraging it. As the senator said, and you're relating to something I think I said in the executive session, Senator, I don't want anybody to think that we are definitely, would have spent the money this way ourselves. As I took pains, I think, to point out, the counties are the ones spending the money. We may not, as a group, have wanted to spend the money that way. If it's allowed under Exhibit E, we are approving it. So you're proper in pointing it out, Senator. You're also proper in voting no if you want to on that particular program. But I would like for you to point them out, and it would help if we would point them out as we go along with regard to specific programs, okay? So going back to the resolution, we're moving for the approval of Allegheny County programs 1 through 3, 5 through 6, and 9 through 13. Armstrong County programs number 1 through 3, and Beaver County programs 2 and 5 through 7. Can I have a motion
I'll
to
make that
approve?
motion.
Okay,
Kevin Boozle.
second? Is there a second? Okay, second. Any further discussion other than Senator Rothman's very appropriate question? Hearing none, may I have a vote? All in favor, please say aye.
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 Opposed?
Nay,
Okay.
Senator Rothman.
And the nay is with regard to the one specific program, is that correct?
Yes, Mr. Chairman, thank you.
Thank you. Okay. Moving on, it passes. Moving on, we are going to go to Berks County, and I think there's probably 29 programs under Berks program. If I'm not mistaken. So we are going to hear from Shay Madden for a while, but you'll be happy to know that Berks was really, they really did a great job in responding, and I think you'll find that the bulk of the programs were recommended for approval.
Berks County number 1. Berks County Jail Vivitrol Program in the amount of $37,000. It's the only program actually out of the 29 that we have requested more information on. I believe that goes back to the medication Vivitrol, just to make sure it was being used for OUD and not alcohol use disorder. Berks County Program number 2. Berks County Jail Medication Assisted Treatment Program in the amount of $302,500, recommending approval. Berks County Program number 3. Berks County Jail MAT Case Management in the amount of $53,398, recommending approval. Berks County Program number 4, Danny's Ride in the amount of $20,625, recommending approval. Berks County Program number 5, Recovery Works in the amount of $203,381, recommending approval. Berks County Program number 6, Residential Treatment Services for OUD, the amount of $180,000, recommending approval. Berks County Program number 7, Student Assistance Program, the amount of $1,597, we are recommending approval. Berks County Program number 8, Community Intervention and Recovery Support in the amount of $23,248, recommending approval. Berks County Program number 9, Connecting with Cookies and Coffee we are recommending approval in the amount of $8,995. Berks County Program number 10, FDA approved medication for outpatient treatment in the amount of $150,000. We are recommending approval. Berks County Program number 11, equine therapy for pregnant and postpartum women in the amount of $35,000. We are recommending approval. Berks County Program number 12, peer-to-peer and family-to-family in the amount of $12,100. We are recommending approval. Berks County Program number 13, Recovery House Support Services in the amount of $41,800. We are recommending approval. Berks County Program number 14, the Response Magazine, in the amount of $13,000. We are recommending approval. Berks County Program 15, Outreach Event in the amount of $4,000. We are recommending approval. Berks County Program number 16, Outreach to the Spanish Community in the amount of $14,850. We are recommending approval. Berks County Program number 17, Youth Leadership Council Recruitment Event in the amount of $594.79. We are recommending approval. Berks County Program number 18, Narcan Media Campaign in the amount of $13,000. We are recommending approval. Berks County Program number 19, Recovery Simulation in the amount of $676.16. We are recommending approval. Berks County Program 20, iHeartMedia Holiday Campaign in the amount of $7,500. We are recommending approval. Berks County Program number 21, Center of Excellence for Non-Medical Assistance Funded Individuals in the amount of $15,000. We are recommending approval. Berks County Program number 22, Contingency Management Harm Reduction in the amount of $72,220. We are recommending approval. Berks County Program number 23, the Bridge Device, which is used in the detoxification services for OUD patients in the amount of $15,000. We are recommending approval. Berks County Program number 24, Medical Fellowship Program. We are recommending approval of $20,000.
No, that one's still,
Oh, sorry, still under consideration. I was on a roll. Forgot there were two.
I misled you by saying that. I'm sorry.
All your fault, Tom. Berks County Program number 25, Project Peace in the amount of $125,778. We are recommending approval. Berks County Program number 26, Drug Court Recovery House renovations in the amount of $41,400. We are recommending approval. Berks County Program number 27, Adolescent Substance Use Mental Health Conference in the amount of $15,000. We are recommending approval. Berks County Program number 28, Kids of Promise, in the amount of $10,000. We are recommending approval. And Berks County Program number 29, Student Athlete Intervention in the amount of $10,000. We are recommending approval. And I do just want to say, as Tom said, Berks County did a great job explaining the programs and really did a great job on all their programs.
So any question on any of those?
Mr. Chairman,
Yes, I'm
I
sorry.
would just like to echo just what Shay just talked about. There are going to be programs that are not going to receive approval today and are still under consideration. But if there is a shining star in this process so far, it would, to me, in the work group that I had a chance to work with Shay on Berks, and I'm actually sharing the gentleman's name with Blair County to have them be able to reach out and understand the importance of program notes to receiving approval. Now, we already did approve one county that did not provide any program notes, but the program clearly fell under Exhibit E. But for any of those folks who are maybe struggling administratively, trying to figure out how to describe, there are people who can help. Don't be afraid to ask for that help. And this is that one that I think really stands out, at least for me. Maybe there's others in some other work groups, we'll find out. But this was really well done.
I would also say, and I'd like for Shay and Kevin to weigh in if they would, but on this, but at the meeting yesterday, at the CCAP meeting yesterday, there was a panel discussion that was presented by various counties as to how they went about making the decisions. And specifically with Berks County, it was a very deliberate decision. A couple things stood out that from word go, their hallmark was it has to comply with Exhibit E. And it was pointed out, look, this isn't the first time counties have gotten monies from the state or from the federal government, usually with conditions attached. And the first thing you have to do is understand what those conditions are. And once you understand the conditions, you should be able to find programs that fit within that. And that was the thing that stood out for me. And I think everybody would be well advised. The fact that there are stipulations attached to this opioid money shouldn't come as a surprise to anybody. It's going to be over $1 billion in Pennsylvania, and people should be held accountable, and there should be certain obligations that they have under it. So thank you, Jim, for those comments. Other comments? Okay, like that, I'm going to move ask for a motion to approve the following resolution. Resolved that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby approves the programs as compliant with the applicable settlement terms as set forth in Exhibit E, Berks County Programs number 2 to 23, and Berks County Program 25 to 29.
We'll make the motion.
Okay,
Second.
second to the motion. Any discussion on the motion? Hearing none, we will vote. All in favor, please say aye.
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 Opposed? Motion passes. Okay, we will move on to Blair County, which was also working group number 3.
Okay, Blair County Program number 1, SAP Evidence-Based Curriculum in the amount of $10,715. We recommend it still be under consideration as we need more information from the county. And Blair County Program number 2, Drug Court in the amount of $322,733.81. Also under consideration as we requested more information from the county.
Which segues from my previous point. Having that information is very, very important in some instances. Some instances, maybe it wasn't, but this is one of those, we definitely needed more information.
Thank you. Okay, any other comments about Blair County? Both of theirs are still under further consideration. Okay, moving on, Bradford County, once again, Shay.
Yeah. All right, Bradford County Program number 1, adding an additional prevention specialist employee in the amount of $56,631.61. We recommended approval. And Bradford County Program number 2, additional case management employee in the amount of $15,985.14 was also recommended for approval. That's it for Bradford. Let me go to that.
Any questions on any question on that before we move on? Okay,
Got all the Bs.
moving on to Bucks County and Shay.
Okay, Bucks County.
I don't know how you got all the Bs.
Yeah, you said we were breaking this up. Okay, Bucks County Program number 1, treatment expansion in the amount of $300,000. We request that it still request more information from the county and would approve still under consideration. Bucks County Program number 2, expanding recovery housing in the amount of $100,000. Also would request more information still under consideration. Bucks County Program number 3, warm handoff for individuals surviving overdose in the amount of $150,000. We would recommend approval. Bucks County Program number 4, outreach and mobile engagement and services in the amount of $100,000. We would recommend approval. Bucks County Program number 5, Narcan purchase and distribution in the amount of $200,000. We would recommend approval. Bucks County Program number 6, community-based mini grants in the amount of $350,000. In the sense that we would not know what those mini grants would be funding, we still have that under consideration and will request more information from the county.
I don't know if it would be helpful, Tom. We were able to track down some details. You could probably get that directly from but I think they do have information on their website. You probably want that reported directly from the county, though.
We want that reported from the counties and that's why it's still under consideration and we will consider that at the June 20th meeting with that further information. Thank you, Dennis.
Bucks County Program number 7, media campaigns in the amount of $150,000. And I think, Tom, you already addressed this. We still have that under consideration as we'd like more information about what exactly that would look like. Bucks County Program number 8, website with family resources in the amount of $2,500. We would recommend approval. Bucks County Program number 9, drug test strip distribution and materials in the amount of $30,000. We would recommend approval. Bucks County Program number 10 in the amount of $400,000, project evaluation, fiscal management, data dashboard reporting, and administrative costs. We had some questions about that and still under consideration. Bucks County Program number 11, jail medication assisted treatment in the amount of $150,000. We recommended approval. Bucks County Program number 12, co-responder program in the amount of $200,000. We recommended approval. Bucks County Program number 13, drug court probation officer in the amount of $200,000. We would like more information from the county, so it's still under consideration. Bucks County Program 14, women and children's housing services in the amount of $200,000. Also still under consideration. Bucks County Program number 15, transportation for DNA services in the amount of $75,000. We would recommend approval. Bucks County Program number 16, alternative activities in the amount of $50,000. We would request more information from the county, still under consideration. Bucks County Program number 17, 24/7 crisis stabilization unit in the amount of $900,000, still under consideration.
That is. And now,
Are there questions so that we can address we can address Bucks County with any questions? I'd like to say that this isn't to pick on Bucks County. It's just it'll be indicative of a couple other that come up, and this is a good place to do it. You'll see the one Bucks County that is still under consideration that was reviewed by Jay. We did get the information. It's providing non-traditional support to youth with families where substance use is prevalent, including but not limited to summer camps, adventure experiences, recreational activities, all with substance use and supported theme. And it's this kind of thing. In addition, there's some counties that might have dealt with playground, for example. We're not saying that there can't be a good use and that people may be, if they were exposed more to summer camps and the playgrounds and the proper playground equipment, that it might help them avoid substance abuse going forward. But we did find it to be a far cry and just need more detail as to exactly how they believe this is going to address the OUD problem that we're all confronting. So you'll see some like this. It doesn't mean that it's not very good intent, but it's ones we need more detail and draw the nexus. Okay. With
I
any,
don't think so. Is there questions?
okay, Butler County.
Okay. Butler County Program number 1, prison MAT in the amount of $232,634.88. We are recommending approval. Butler County Program number 2, Courage to Change journaling program in the amount of $22,195. We are recommending approval. Butler Program number 3, Hope is Dope community outreach in the amount of $100,000. We were requesting some more information from the county and still under consideration. Butler County Program number 4, Recover Empower Institute MAT support group in the amount of $89,550. Also had some more questions and still under consideration.
Okay. Any questions about Butler County? Okay, moving on, Cambria County.
Cambria County Program Number 1, the Cambria County Rise Project, $1,921,000, 804.75. That is still under consideration. The points there, but we needed definitely additional information. I think I have the next one, correct? Cambria, yes. Cambria County Program Number 1. It is the Cameron County Detective Initiative, $20,000. That one is still under consideration. We need a little bit more info about that program as well. You can scroll down. All right, Cameron County, excuse me, number 2, program number 2, governmental agency assistance initiatives, $45,684. That is still under consideration. It looks like it's based on, I think we had some questions in relationship to salaries. Next one, Cameron County Program Number 3. That is the district magistrate office staff wages, $15,000. Also, we needed additional information for that one.
Carbon County's mine. Thank you, Jay, for giving me a chance to get in. You make me look bad. You did all that work. Carbon County project number 1, prevention advertisement number 1, $200,000. It is recommended for approval.
And back to me.
Okay, we're gonna have a resolution. So we are at a point where we can seek a approval of another 30 or so. So does anybody have any questions concerning the ones we reviewed on Bradford, Bucks, Butler, Arbon, or Cameron counties?
I would just like to make a note, Mr. Chairman, I'll abstain from the Butler County as a commissioner, making those decisions.
Thank you. Okay, with that, we will have the resolution resolved Board of Trustees of the Trust based on recommendations of the working groups. Hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Bradford County programs number 1 and 2, Bucks County programs number 3 to 5, 8 to 9, 11 to 12, and number 15. Butler County programs number 1 and 2, Carbon County program number 1. Can I have a motion to approve that resolution?
Motion.
Okay, motion's made. Second? Jim Gregory, second. Okay, discussion. All those in favor, please say aye. Opposed? Motion passes. Okay.
In the minutes, Commissioner.
And yes, the motion will reflect the abstention. Okay, we will move on to Center County. Back to you, Shannon.
Center County program number 1, contingency management, transportation funding in the amount of $50,000. Still under consideration. We had more questions for the county for the program. Center County program number 2, the bridge device for $12,000. We recommended approval. Center County program number 3.
Okay, I'm sorry, if I could go back to number 1. This is an example, and we will have approved a number of transportation funding. I don't want you to think that we're sending it back for more approval because we're in disagreement that funding for transportation to get people to treatment facilities or to have them be able to have access to different programs is not permissible. But when it comes under the guise of both drug and alcohol, we are requiring people, we do want to know what percentage is being used on opioids as opposed to being used for alcohol and or perhaps other programs that transportation services are used for. So you'll see that come up on a number of them, but this is really going to be a question of getting information as to the exact percentage use of the program. Shay, sorry about that.
That's okay. Did I finish number two?
Yes.
Center County Program number 3, sober living house support in the amount of $10,000, still under consideration. Center County Program number 4, recovery center needs in the amount of $25,000, still under consideration. Center County Program number 5, meeting maker program in the amount of $2,500, still under consideration. Center County Program number 6, language interpretation support in the amount of $2,500, still under consideration. Center County Program number 7, student assistance support services in the amount of $25,000, again, still under consideration. And Center County Program number 8, Narcan media campaign in the amount of $32,672, still under consideration. And I would note that we lack detail with those programs.
Great. Thank you. Any questions about the Center County? Okay, moving on to Chester County, Secretary.
Yes, Chester County Program number 1, International Overdose Awareness Event, $350,000. It is recommended for approval. Chester County Program number 2, Gadenzia Wellness Seminar and Women with Children Conference, $50,000. That was recommended for approval. Chester County Program number 3, naloxone, Narcan, that was recommended for approval, and sort of the same guidance to Pennsylvania has the POP program. There's an opportunity for counties to receive free naloxone that way. Chester County.
Secretary, Senator Rothman has a question.
Sure.
Oh, I'm sorry. After Secretary is done, I'm sorry.
Okay, no problem.
Chester County.
So Chester County comment.
Yep. Chester County Program number 4, Narcan kit supplies, that in the tune of $6,871. That is recommended for approval. Chester Program number 5, medication lock boxes, in the tune of $24,977.51. That is recommended for approval. Chester County Program number 6, Social Recovery Event for Families, $1,197. That is recommended for approval. Chester County Program number 7, Recovery Support Literature. The amount is $4,927. It is recommended for approval. Program number 8, the media campaign, $3,070. That is still under consideration. We just wanted to ask some key questions. Program number 9, community recovery resources, $31,000 and $31,060. We are putting that still under consideration. Program number 10, it's program number 10, warm handoff expansion, $204,770. We're talking about that one is still under consideration. We needed additional information. Chester County Program number 11, Valley Creek Crisis Stabilization, $35,000. That is still under consideration. Chester County Program 12, Prevent Future Overdose Toxicology Testing, $140,000. That one still under consideration. Chester County Program number 13, Expanded Testing, $250,000. That one still under consideration. We need some additional information. Chester Program number 14, I'm trying to say that, Equestrian.
Equestrian.
Just trying to get that out. recovery support of $14,000 and $74.43. That one is also still under consideration. Chester, MAT in Chester County Prison, $707,000, $236.49. Recommended approval. Excuse me, I'm trying to read these lines. Can't read from the screen. I'm reading from my paper and I'm losing my lines. Excuse me. Chester, I think I'm on 16. Community mobilization, $80,000. That is recommended for approval. Chester program number 17, prevention media campaign, $40,000. That is recommended for approval. Chester County number 18, family education program, $10,000. That is recommended for approval. Chester County program number 19, SAP school programs, $69,000, recommended for approval. Chester County program number 20, prevention awareness and alternative activities, $5,210, 73 cents. That one is still under consideration. We have Chester County program 21, information dissemination, stall stories, 45,000. We're talking, that one's still under consideration, had some additional questions. And then Chester County program 22, information line, a little bit over $1,000, 1,212, still under consideration. Chester County program 23, prevention community awareness, $3,940. That was recommended for approval. Chester program number 24, ambulatory services, $494,320. That was recommended for approval.
Secretary,
Chester,
Secretary, this is, if we could go back just to, I think it's 21.
21, okay.
Okay, 22. I just want to know, you may ask why it's $1,200 that is listed for this program. We really didn't understand what it was. It may seem like, oh, well, what's $1,200 in the whole scheme of things? But in our opinion, in the working group's opinion, this could be, if we approve this, it could, without further information, without knowing what it is, next time around, a county could come back and say, okay, we spent $200,000, you approved it last time, automatically, you must think it's okay. So there is no item on this that the working groups felt to be too small from a dollar standpoint, that if we weren't aware of what the real use for the program was, that we didn't send it back for further consideration. And that's just a good example of that. I wanted everybody to realize that.
Thank you, Tom. Where did I leave off?
You're on
25.
25.
All right, Chester County, program 25, medication assisted treatment. That's a little bit over $9,000, $9,614. That was recommended for approval. Chester County program 26, transportation to recovery events, $10,840. That was recommended for approval. Chester program 27, recovery housing, $10,000. That was recommended for approval. Chester County program 28, maternal dependency program, $50,000. That one was still under consideration. Chester County program 29, 988 crisis center, $300,000. That one is still under consideration. We had some questions. Chester County program number 30, certified recovery support, $296,000. That was recommended for approval. Chester County Program 31, Project Sticker Shock, a little bit over, close to $2,000, $1,867. We felt that that one was non-compliant. We did not recommend, and we didn't ask for additional consideration for that one. Chester County, number 32, Program 32, Prevention Information Dissemination, 37,458. That one is also still under consideration. And Chester County Program 33, Prevention Evidence-Based Education, 32,622. That one is also still under consideration.
Okay, thank you. Okay, any questions on any of the ones under Chester County? Senator Roth.
Thank you, Mr. Chairman. I wanted to specifically address Chester number 12, which is still under consideration, and just make an appeal that this is the type of it's what it is the coroners in our counties have been inundated with additional toxicology reports that they're required to use, both for prosecution of maybe the supplier, but also in order to track deaths by overdoses, and maybe even deaths that may not appear to be, but due to the toxicology test determine that the person succumbed to some kind of opiates in their system. So I know it's still under consideration. I would just hope that we would allow that. And I think there are a couple cases later today that we'll be discussing where we didn't allow that, or we're not allowing it. So I just wanted to make a case for the coroners who have been certainly put under a great deal of burden due to the opiate crisis. Thank you.
Senator, thank you very much. And you're right, there are 5 or 6 programs that we'll be considering going forward. I think in each of them, we did ask for further information. The thing I know that each of the working groups was weighing with respect to these requests really was it for ascertaining or for future treatment what the exact cause of death was, and in a prompt manner, as opposed to being used for law enforcement purposes in order to prosecute other people. So that was what we're really sending it back for. But the leaning of each of the work groups, I can say, is exactly in accord with what your plea was for us to positively consider these kind of programs. But we will be sending each of them back to get the further information. But thank you for pointing it out. Other questions with regard to Chester? Hearing none, we will have a resolution. There's 2 resolutions with respect to Chester. One is resolved that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. And I'm sorry, this relates to both Center County and Chester County. First, Center County, it's program number 2. With Chester County, it's programs 1 through 7, 15 through 19, 23 through 27, and number 30. May I have a motion to? Yeah. Can I have a resolution to that effect? A motion to that effect. So moved by Jim Gregory. Other second?
Second, Kevin Boozle.
Second by Kevin Boozle. Any questions? All those in favor of the resolution, please say aye.
Aye.
Opposed? Thank you. And the further resolution that we need with Chester, because we did have a disapproval, further resolved that the Board of Trustees of the Trust, based upon the recommendation of the working group, hereby disapproves the following program as non-compliant with the applicable settlement terms as set forth in Exhibit E, and that is Chester County Program number 31. Now I have a motion to that effect.
Make a motion.
So moved.
Dr. Secretary Davis, turn.
Second,
One second.
second by Shay Madden. Any discussion? All those in favor, please say aye.
Aye.
Opposed? Okay, motion passes. We will move on to Clarion County. And that is Secretary Davis Jones.
Yeah. Clarion, program number 1, school salt works presentation, $2,500. That was recommended for approval. Now we're on to Clearfield. Clearfield, program number 1, 65, contraband prevention, $65,000. That was recommended for approval. Clearfield, program number 2, $35,000. Sorry, let me go back. MAT in Clearfield County Jails, $35,892.77. That is recommended for approval.
That's Clearfield.
Okay, that's Clearfield. Clinton, moving on. Kevin.
Yes, sir. Clinton number 1, West Branch, drug and alcohol opioid treatment, remediation program. We did recommend that for approval at the amount of $200,000. Clinton number 2, prime care treatment for correctional facilities, $241,145. Treatment for incarcerated population. It was also recommended for approval.
Okay, Columbia County, Secretary Davis Jones.
Yes, Columbia County, program number 1, Recovery Community Services Program, $333,409, recommended for approval.
Okay.
And then
Okay.
it looks like we're going to Cumberland.
We're going to move on to Cumberland because Crawford County did not list any programs.
Cumberland, program number 1, Cumberland County Prison Medication Assisted Treatment, $586,499. That is recommended for approval. And then we're moving on to Dauphin County, program number 1, opioid remediation grant program, $85,000. That was recommended for approval. Dauphin, program number 2, transforming and monitoring recovery support, $75,000, recommended for approval. Program number 3.
If I could go back to number 1, if you don't mind, but because I think it's important to address it while it's there. There was a similar type of use done by York County with respect to an organization that was created providing leadership, planning, and coordination. And we went to both York and Dauphin and did ask them for additional information. Both Dauphin and York did submit that information. In the case of York, which you'll see when we get there, we did deem the program that or the advice that they had set up as being appropriate. With respect to Dauphin, there were still some questions remaining about Dauphin. This is for hiring really an outside service. And I believe, Senator Rothman, you had a question about Dauphin number 1, and I wanted you to have an opportunity to bring it up here as opposed to after we go through some of the other ones.
Thank you. Yeah, I just want information. I'd like to, if we could amend the recommendation to be, request for more information as opposed to approve. This was a large $85,000 payment. I don't know if this is a one-time payment. This is for hourly work. This is going to be, if you take this over a 3-month period, are they going to be paid $85,000 every quarter? I know we've requested more information. We've gotten some. I did review the information we got back, but I would like to see more information, especially when it comes to this specific program in one of my home counties. So I'm just asking to move this to still under consideration while we get more information.
And that's very well taken. And you did provide us with that information, I believe, last Tuesday after the initial information had gone out to the trustees. It's just, I wanted you to use this. I wanted everybody to see this. All of these are a work in progress. We change when different situations arise, as we should. Dolphin did get it back to us. The working group leaned toward approving, but the senator correctly pointed out he believes we still have to delve into it more. Very appropriate. So we did change it, and on the sheet that you see under your on your screens, it is still under consideration, and we will be seeking additional information. I just wanted to point it out here before it got wrapped up in everything else. Thank you.
Thank you, Mr. Chairman.
All right. Not sure where I left off.
Number
Come
two.
on. Oh, number two? Okay, number two. All right, that's the transforming and monitoring recovery support, $75,000. It was recommended for approval. Dauphin County Program 3, the Renew Program, $75,000. It's under consideration still. Program number 4, St. Samuel Center Social Determinants of Health Expansion Project, $75,000. That one is still under consideration. Program number 5, Dauphin County Aspire, $75,000. That one is still under consideration. Dauphin County Program number 6, Dauphin County CASA, $28,000, still under consideration. All right, Dauphin County Program 7, Trauma Treatment Integration, $70,499. That one was recommended for approval. Program 8, Dauphin County Reentry Case Management, $75,000. That was recommended for approval. Dauphin County Program 9, Hamilton Health Opioid Remediation Program, $75,000. That was recommended for approval. Program number 10, Recovery and Reentry, $74,184. That was recommended for approval. Program 11, Police Peer Program, $75,000, recommended for approval. Program 12, Center for Addiction Recovery, $75,000, recommended for approval. Program 13, Bridge Device, $21,780, recommended for approval. Dolphin, number 14, Pennsylvania Adult and Teen Challenge, $60,000, still under consideration. Program number 15, the Neiman Center, I may be wrong, $70,000, still in consideration. Dolphin Program 16, Vending Machines for Community Health, $75,000, still under consideration. Dolphin Program 17, MAT Education Training and Mentorship, $75,000, recommended for approval. Dolphin number 18, Penn State Health Maternal Substance Use Disorder Program, $75,000, recommended for approval. Dolphin Program 19, Administrative Oversight, a little bit over $3,300. That one was still under consideration. I think we just had some questions about the charge for that particular service. And then
I would if I could. I'm sorry, go ahead.
Go ahead.
I would like to just point out in the Dauphin County, you probably saw a number of programs. Just off the top, if you look at programs 8 through 13, we did recommend approval, even though there are no detailed notes on the material in front of you. There was very detailed notes that were supplied to the working groups, part of the notebooks that Penn State, and the attachments that were attached to it, some of which may have been supplied later. All of those were taken into consideration, and there was full information available. On the other hand, with respect to some of them, particularly the grant programs at the beginning, typically when they would have issued a grant to a program and that the grantee did not supply that kind of information, we sent it back for further consideration. So I wanted you to know that we are not just picking and choosing some. For the ones that we recommended approval, we did have the working group add the full detailed information behind it, and it was also available to Penn State. Okay, sorry, Secretary.
I think we're at the resolution.
Okay. Any questions about Dauphin County or any questions about Dauphin County?
Mr. Chairman,
Yes.
if it would be okay by you to explain, I think this is a good opportunity, because I think there was only one other county, and I think it was in our work group, Shay, that vending machines were brought up. And this one in particular was still under consideration. I'm curious why it's still under consideration. I think I know, but I think it's worth explaining perhaps why it's still under consideration, because in those vending machines, it's an opportunity to say how much of the money is being appropriated for opioid use disorder versus other products that may be in a vending machine.
Right. Secretary, I believe there was a detailed discussion in your working group about that. So if you could address specifically the question of the vending machines.
Yeah, again, well over a month or so ago. I can't remember all of the details, but I do think it was tied to understanding what products and what portion of those products are geared toward OUD remediation. That's what I'm recalling. I don't, if you all have any other notes outside of that.
Yeah,
But I think
we had
go ahead.
I think you're exactly right. You have a very good recollection from a month ago. We had no explanation as to what products were being distributed. And we wanted to make sure, in some cases, we know Narcan is one of them, but exactly what other products? And the other question was, do people actually have to pay to get it out of the vending machines as opposed to be readily available for use? So therefore, was it really being used in the right way? Was the money, if it's just spending money on a vending machine that people had to pay money to get the product out, how is that working toward opioid remediation? So in the case of Dauphin County, we're requiring further information. I think in the case of one under your working group, Jim, there was a full description of how the vending machine was used. In fact, I think there was a picture of how it was being used, and we found that it was compliant, but that was my recollection.
And thank you.
Yeah.
If I may add some additional conversation to this, in our breakout group yesterday at the symposium, these were brought up. And they had two different vending machines. One cost $30,000, one cost $8,000. Similarly used in the fact that they don't charge, but they won't keep distributing. And one will all automatically be connected to the internet and let them know they need to restock. The other one didn't. So the fact was that 90% of the product, I would say, what they were describing was wound care kits, naloxone, mask and gloves, those types of things were in there. But then they added in gloves and hats and winter wear, socks, those types of things for homeless. So it was an interesting conversation. So those are the type of products, but I don't think they're charging for any of it, at least from the two groups that reported out in our breakout, just to give you some clarity.
And as Dennis Scanlon pointed out, once again, yesterday at the CCAP meeting, but I think everybody should be aware, and I just want everybody to be alerted. Once this money became available to the county, obviously there were a lot of people out there who had a lot of devices that they wanted to sell, a lot of programs that they wanted to foist on anybody who had the money to spend for it. So we wanted to alert the counties, and part of going back for further consideration on some of these is to make sure the counties realize that not every product that is being put on the market across the country, not just in Pennsylvania, is a product that, although it sounds as if and might well be available under be used properly under Exhibit E, not all these vendors are reputable, and they have to be very careful in getting the products And if you're gonna be purchasing a product, make sure you know what you're getting. So that's a good place to bring this up, Kevin. Thank you very much. Okay, other questions under Dauphin County? Okay, with that, I would have to make a,
Sorry, Tom, can I go back to Clinton real quick?
yes,
Just, I will abstain from that as I am affiliated with one of the programs. And also just wanted to point out that I know that $200,000 to West Branch Drug and Alcohol is incorrect in this. So I think there was some data entry on there.
okay, we will correct the 100,000 and also note your abstention. Thank you. Okay, resolved that the Board of Trustees of the Trust, based on the recommendations of the working groups, hereby approves the following programs as compliant with the applicable settlement terms set forth in Exhibit E. Clarion Program Number 1, Clearfield County Program Number 1 and 2, Clinton County Programs 1 and 2, Columbia County Program Number 1, Cumberland County Program Number 1, Dauphin County Programs Number 2, 7 to 13, and 17 to 18. May I have a motion to support that resolution? Jim Gregory, is a second.
I'll second.
Second by Kevin
Yep.
Boozle. Okay, any discussion on the resolution? All those in favor, please say aye.
Aye.
Opposed? Motion passes with noting the abstention by Shay and subject to the correction of the one program under Clinton. Look, we're through 19. I know it's hard to believe, but we're through more than a third of what the programs are going to be. We're on page 19 out of 51. So I think now would be an appropriate place to take a 7 to 10 minute break for restroom purposes. If everybody could plan on being back on the phone by 11:05, I would appreciate it. And we'll take that break. Thank you.
So this is just, the program you just mentioned, was this updated or?
Hey, Tom or Heather, can you guys hear me?
We can hear you.
Okay, great. Hey, I didn't, and we didn't discuss this in executive session. I didn't abstain from Allegheny County. As you guys know, I wasn't part of the working group that made any of the determinations or recommendations around Allegheny County, but if you'd like me to go back quickly for the record and abstain from Allegheny, I obviously happy to do that. I don't know if it's necessary, but if it is, wanted to point it
We
out.
were all just kind of struggling. It's probably not necessary, but if you would feel better doing it, that's fine.
I think it's fine. As long as you guys think it's okay, then
I think it's fine. Thank you.
okay.
Tom, I
Thanks,
can
Eric.
vote on Philadelphia?
Excuse me?
May I vote on Philadelphia or should I abstain?
Nope, you may vote.
Thank you.
Okay, great. Thank you.
You're welcome. Okay, we ready?
Right.
Yeah. Let's see.
You know.
Yeah.
That's what Jason just
Yeah,
said.
I think we can flag that duplication. Right, we were taking it at face value, obviously.
Okay, whenever you are ready, Tom, we're gonna start.
We're gonna need Kevin.
Well, he's getting some food.
That's fine. We all,
We are.
okay, we'll get started in just a minute.
Ready to go.
There we go.
Had to get my
Got
silence,
some
you're yelling at me for eating a donut. All right,
Kevin, before you start,
Yes,
so you can dig into your salad maybe. Would like to say a question was asked concerning the spreadsheet that is up in front of you now. Currently, only this was all circulated to members of the trust before this meeting. It is our intent to post it on the website for the opioid trust immediately following this meeting, or give us until tomorrow morning, but the spreadsheet is going to be going up on the website, and so people don't have to worry about it. And obviously, it's also part of the video presentations that will be made. So
if I may have, will the notes or documentation from this meeting be noted on there as well? As to abstentions and to, will be noted in program notes or other one, or the correct were made by Shay or.
if there were corrections, yes, we will make the corrections and make note of that. Yes,
Thank you.
thank you.
All right, Mr. Chair, I believe we're ready to work on Delaware. They've got quite a few programs. So Delaware project, program number 1 is the opioid crisis response center. It is recommended at $1,094,652.03. It is recommended. Delaware project number 2, resilience after infant substance exposure, $68,567. It is recommended for approval as well. Delaware number 3, under the substance use harm reduction for families, $175,350.97. It is also recommended for approval. Delaware number 4, it's under the community action. It's assessment and therapy for homeless and near homeless households, $150,132. Also recommended for approval. Delaware number 5, targeted case management for pregnant women and children, $80,000, also recommended for approval. Delaware project number 6, transportation services, $50,000, also recommended for approval. Delaware number 7, project, Delco Revive, $137,286. It's a naloxone program. It is recommended for approval. Delaware project number 8, Deterra, $999,998.45. Also recommended for approval. Delaware number 9, Warm Handoff Recovery Program Expansion, $81,000, also recommended for approval. Delaware number 10, Multicultural Family Services under Prevention, $108,729.74, recommended for approval. Delaware project number 11, Medication Assisted Treatment, $861,640, also recommended for approval. Delaware number 12, Prevention Education, $100,000, recommended for approval. Delaware number 13, Care Connect Warm Line, $173,098, recommended for approval. Delaware project 14, Education and Training, $66,500, recommended for approval. Delaware project number 15, CEU program targeting pharmacy related providers, $180,900 under prevention over prescription, recommended for approval. Delaware project 16, opioid addiction education and prevention series for medical residents and students, $157,500 under prevention, overdose, death, and other harm reduction, recommended for approval. Delaware project number 17, working group to develop curriculum for K through 12 students focused on opioid prevention, $62,500, also recommended for approval. Delaware project number 18, housing and outreach, $537,000, also recommended for approval. Delaware project number 19, First Health Program, $45,880, recommended for approval. Delaware project number 20, Nutrition Sober Communities, or Nurturing Sober Communities, excuse my ignorance, sir, $23,000, recommended for approval. Oh. Delaware project number 21, stabilization and enhancement of the Journey program, $60,430, also recommended for approval. Delaware project number 22, opioid service delivery expansion program, $146,000, 419, also recommended for approval. That concludes Delaware County. I will move on to Elk County unless there's any questions.
I would just make a comment. Once again, you'll see that there is not much information under the program notes. That is because Delaware County submitted along with its material very, very detailed information concerning each of these programs. As you can see, many of them were is where they contracted with outside services. They provided the contracts and let us see exactly what the money was being spent on. So in addition to the accolades that we threw out to Berks County a little bit earlier, I think Delaware County, who had all of their programs approved, also we should throw out an accolade to them. But I wanted everybody to know that all of the backup information was made available to the working group in going through this.
Very thorough, thank you. Great comment. I'd like to move on to Elk County project number 1. Family centers and pre-K counts building renovations, still under consideration for $30,000. Again, it becomes a percentage question. Elk County project number 2, children's calming room, $12,814. Again, still under consideration. Elk number 3, Elk County Prison MAT program, $4,542.35. We recommend approval. That concludes my Elk County report.
And with respect to Elk, I would point out one thing, because we do have a program where the technical advisory group of the trust tries to give advice to counties before if they have a question. Elk County was one that raised the question with regard to public defenders that we specifically addressed, that we don't believe that paying for a public defender per se is permissible, even though programs that might be developed by public defenders' offices may be very important and can be provided. But it was under the reasoning that public defenders already have to be provided by the counties. It's required by the state, and therefore a public defender, even though programs that may be developed or social workers that might aid the opioid abuse program may be permissible. A public defender itself is not. So you'll see that Elk took our advisement to heart and did not submit a request for reimbursement or request for approval for the public defender question that they had raised to the technical advisory group.
If I may add just one piece to that.
Yep.
We also received notice as county for the first time ever in Pennsylvania, they were supplying funding for public defender's office. We're one of 2 states that never funded that. This is the first time they're funding it. I believe my county receiving $95,000. So they are starting to pay for the indigent defense.
Good. Okay, Erie County.
Erie County program number 1 is an outreach project in the amount of $61,136, still under consideration. Erie project number 2, education and public media campaign in the amount of $35,725, also still under consideration. If we have some questions about both of those programs, targeting OUD. Erie County program number 3, MAT, medication assisted therapy in the amount of $234,000 at their Department of Corrections in the county. We recommended approval. Erie County program number 4, Hope Health and Opioid Prevention Education in the amount of $85,000. We recommended for approval. Erie County program number 5, Enhanced Engagement Project, residential programming, $6,277, still under consideration. Erie County project number 6, MAT expansion at the Erie County Prison for $118,833, still under consideration. Erie County project number 7, Enhanced Engagement Project at Outpatient Clinic in the amount of $31,778, still under consideration. Erie County project number 8, program enrichment in the amount of $4,954, also still under consideration. And again, just lacking some details with those programs. Erie County project number 9, OUD library collections in the amount of $22,000, still under consideration. Erie County project number 10, overdose prevention in the amount of $30,500, still under consideration. Erie County project number 11, Erie County certified recovery support specialist at $150,000, still under consideration. Erie County project number 12, National Training Summit for Erie County Police Department, still under in the amount of $10,285, still under consideration. Erie County program number 13, DNA office projects in the amount of $126,250, which they did provide additional details under the projects, and we recommended that for approval. And that is it.
Okay. Any questions concerning Delaware, Elk, or Erie counties? That I'd like to make a resolution that the Board of Trustees of the trust, based on the recommendations of the working group, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Delaware County programs 1 through 22, Elk County program number 3, Erie County programs 3 and 4, and also number 13. May I have a motion to that effect?
Make the motion.
Motion made, second.
Second.
Second, thank you very much, Senator. Any discussion? All those in favor, please say aye. Opposed? Resolution passes. We will move on to Fayette County, which was Kevin's group.
Thank you, Chair. Fayette County project number 1, city mission, housing for people with SUD $100,000. We did recommend that for approval. Fayette, project number 2, wellness recovery. Also expansion of recovery services, $189,322. Also recommended for approval. Fayette, project number 3, drug testing, $27,243. This is also recommended for approval. Fayette, project number 4, JPO, expanding education to youth, $9,235.92. It's still under consideration, requesting additional information. Fayette, number 5, project, State Police Education Program, $618.26. This is one of those ones that we still question, still under consideration. Fayette, project number 6, expansion of warm handoff program, $199,503, recommended for approval. Fayette, project number 7, warm handoff, $1,880, is also recommended for approval. Fayette, project number 8, women's support group, $4,578, also recommended for approval. Fayette, project number 9, drug treatment for inmates, $136,044.14, also recommended for approval. That concludes my report for Fayette.
Thank you. Any questions concerning Fayette County? Moving on to Forest, which they're in the process of creating it, but Kevin, would you like to I'm sorry, Shay, would you like to make the recommendation?
So Forest County program number 1, they are talking about a opioid abatement advisory committee in the process of being created, waiting on a resolution to be approved. They have not requested funding at this point, or money to fund that. So we are still under consideration with them.
Thank you. Moving on to Franklin County. Secretary.
Yep, ready to go. Franklin, program number 1, recovery oriented systems of care specialist, $5,662.07. That is recommended for approval. Program, we're going next to Fulton.
Next to Fulton County, and that is Kevin's group.
Thank you, Mr. Chair. Fulton County project number 1, NARKIT, naloxone box installation, $9,750. It is recommended for approval. Fulton project number 2, medically assisted treatment startup, $40,000. It is also recommended for approval. Fulton County project number 3, recovery to employment planning initiative, $30,000. This is also recommended for approval. In Fulton County, number 4 project, FCMC medication take back box, $10,000. It is also recommended for approval.
Thank you. And once again, we appreciate Fulton County's efforts. They were 4 for 4 and provided all the information that we were requesting, and we really appreciate their thoroughness in responding. Next is Greene County.
So Greene County did not submit any programs.
Okay.
Then to Huntington.
Sure. I don't know if there's questions on Green, but
Nothing under Greene.
I
Okay.
think something that needs to be noted, I'm sorry. I think something that needs to be noted is when we see that, we need to pay attention to that count. And we need, as a trust, to provide technical assistance if we need it.
Yeah.
So we need to do a reach out at some level, whether it be to the commissioner or to the SCA. But I think that is under our advisement of checking in.
Yes. Thank you.
if I put my CCAP hat on, Bree and I sat in a work group session yesterday. And a lot of that came up in terms of, hey, we need a little bit extra time to spend the money to get the inner workings of the county put together and to get the proper structure in place so that they can have the stakeholders at the table to make the decisions.
So
So
they're in process.
I believe most of them are in process, but I 100% support, kind of keeping an eye on that and working with CCAP to reach out.
And that's why we have you as a facility.
Will be noted.
Okay, we're gonna move on to Huntington County, which is Shea. I would like to note that Huntington, Judiana, and Mifflin, they all have joint programs. I guess they're all under the same SEA, and they all have joint programs, so that what you're seeing here for Huntington will also be dealt with Judiana and Mifflin counties. Thank you.
Huntington County Program Number 1, Crisis Line Digital Media in the amount of $36,963.69, still under consideration. Huntington County Program Number 2, Medication Assisted Treatment in the amount of $314.58, recommended approval. Huntington County Program Number 3, Reentry Services in the amount of $2,896.84, still under consideration. Huntington County Program Number 4, Stigma Reduction in the amount of $38,169.78, also still under consideration. Huntington County Program Number 5, OUD Training Efforts in the amount of $9,733.86, also still under consideration. Huntington County Program Number 6, Prevention Programming in the amount of $5,683.55, still under consideration. Huntington Program Huntington County Program Number 7, Recovery Support in the amount of $3,073.54, we recommended approval. Huntington County Program Number 8, Treatment and Intervention Services in the amount of $37,039.63, we recommended approval.
Okay, any questions about Huntington? Moving on to Indiana, Kevin?
Indiana, project number 1, Armstrong, Indiana Clarion, is a similar program to the Clarion and Armstrong, which is school salt work presentations, $2,500, also recommended for approval.
Okay, and this is another one where we will be going back to the county and addressing the fact that they've only spent $2,500 and that they have to be addressing how they're going to be spending the money. Okay, Jefferson County.
Jefferson County Program Number 1, County Jail Therapist, $43,000. That one is still under consideration. Jefferson Program Number 2, MAT, MOUD, $67,809. That one is also still under consideration.
Okay, Judiana County is also yours.
Yes, Program Number 1, Crisis Line Digital Media, $45,953, 80%. That one is still under consideration. Program Number 2 for Judiana County, Medication Assisted Treatment. That one was approved, a little bit over $1,300. Program Number 3, Reentry Services, $3,396. That one is still under consideration. Judiana Program Number 4, $66,524. That is for a stigma reduction program. That one is still under consideration. Program Number 5, OUD Training Efforts, $23,490. That one is still under consideration. Judiana Program Number 6, Prevention, $19,727, still under consideration. Judiana Program Number 7, Recovery Supports, that one was recommended for approval. Judiana Program Number 8, Treatment Intervention Case Management Services, $36,766. That was recommended for approval. Now it's time for a resolution.
Okay, thank you very much. So we are due for our next resolution. It's going to be dealing with Fayette, Franklin, Fulton, Huntington, Indiana, and Judiana counties. Board of Trustees, based on the recommendations of the working group, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Fayette County programs 1 to 3 and 6 to 9. Franklin County program number 1. Fulton County program 1 to 4. Huntington County programs 2, and 7 to 8. Indiana County Program number 1, Juniata County Programs 2, and 7 to 8. May I have a resolution to that? So move.
So moved, Kevin.
Second? Second by Jim Gregory. Any discussion of any of them? Okay, all in favor, please say aye.
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 Opposed? Hearing none, motion passes. Okay.
Chairman, I'd like to abstain from that, given our relationship with Juniata Valley Pike.
Okay, Robert Postal is abstaining from the vote.
From Juniata and Huntington counties only, but otherwise in favor.
Yes.
Okay, that's what we've been doing.
Yes. Okay, thank you.
Thank you. Okay, moving on to Lackawanna County, which ought to be fairly easy for you, Shay.
So they did not submit any programming. The county to. Look at that.
All right.
Okay. Next is moving on to Lancaster County Secretary.
Lancaster program number 1, MAT cost $200,000. That was recommended for approval. Lancaster program number 2, BHDS staffing, $69,000. That is still under consideration. Lancaster program 3, Blueprints for Addiction Recovery, $75,656. That is still under consideration. Lancaster program number 4, Drug and Alcohol Staffing, $210,000, still under consideration. Lancaster program number 5, Community Prosecutor program, $84,764, still under consideration. Lancaster program number 5, other programs, $5,329, still under consideration. And I think, Tom, I think that this is a lot about us sort of trying to understand, I think, salaries. This was related to salaries for those roles.
Yes, it was for that, and also to the extent it was being spent on prosecutors and police, and we just wanted further information from them as to exactly how the money was being spent. So most of them under Lancaster County are going back for further information. Okay.
All right.
Any other questions about Lancaster? Moving on to Lawrence County, Shay.
Lawrence County Program number 1, Lawrence County DUI program in the amount of $100,000. We recommended approval. Lawrence County Program number 2, Project Lazarus through Vision Ministries in the amount of $78,750.50. We recommended approval. Lawrence County Program number 3, hair follicle drug testing for Lawrence County CYS and APO in the amount of $16,000. We deemed to be non-compliant. Lawrence County Program number 4, Lawrence County Family Wellness in the amount of $50,000, recommended for approval. Lawrence County Program number 5, Lawrence County Public Safety Training in the amount of $20,000, we recommended for approval. Lawrence County Program number 6, Police Cruiser Integrated Data Systems Upgrades in the amount of $17,500, we deemed this non-compliant. Lawrence County Program number 7, Rapid Forensic Toxicology in the amount of $25,000, we deemed non-compliant. Lawrence County Program number 8, Flock Safety Initiative in the amount of $140,450 through the Lawrence County District Attorney's Office, we deemed non-compliant.
Okay, moving on to Lebanon County, Shay.
Lebanon County Program number 1, MAT programming maintenance of the jail in the amount of $1,916,145.54, still under consideration. Lebanon County Program number 2, correctional officer to facilitate MAT maintenance program, also still under consideration. I think we had a lot of questions. It was a big ticket number and what all that would be funding. Lebanon County program number 3, adult probation case manager in the amount of $1,643,693.58. Also still under consideration. Need more information from the county.
Okay, I'm moving on to Lehigh County, and Greg, I will give you an opportunity, or Kevin will give you an opportunity, who's going to be going over this with respect to number 3. If you want to suggest a different resolution under that, it once again deals with the issue of autopsies, which you had brought up earlier. So Kevin, do you want to go through Lehigh, but give Senator Rockman an opportunity to discuss under number 3?
Absolutely. Lehigh County project number 1, jail recidivism reduction MAT program, 22-03, $505,000. They did have a good attachment, and it is recommended for approval. Lehigh number 2, Lehigh County Drug and Alcohol Services out-of-pocket insurance balance program, 22-06, $50,000. It is still under consideration. Lehigh number 3, county project is the coroner autopsy, 22-08, for $30,600. It is under the first responder category of schedule, and it is non-compliant according to the group. But I would open it up now for any comments.
Senator Rockman?
Yeah, thank you. Yes, thank you. Just a similar comment, and I did do a little more research in between the last comment and now, but I understand the concern about the toxicology reports being used for prosecution, but this is also an important way of us tracking, the current status too, and will help in treatment. So I'm not sure in the working groups, if because I was not part of this working group, that the issue was how they defined what the purpose of the toxicology report was, and we know they're doing them. We know that there's a huge burden on our coroners, and I would think anybody who is in contact with their county coroners knows the service they provide. They're often it's I think it's one of the toughest jobs there is, but they're also under a lot of stress, financial stress, and this would relieve that. And certainly the opioid crisis has affected the coroner operations. So I would like to suggest we again maybe ask for more information or discuss this. I certainly think the CCAP could be a resource for us, because my guess is that not just Dauphin County and Cumberland County, but every coroner that in the state is dealing with these issues and these additional costs. So.
Okay.
And I believe we are doing toxicology tests. We're doing drug testing in prisons and drug testings, 24-hour drug testings for, the court system. So just the fact that this specific test is on someone who's deceased doesn't seem to be in conflict with the court's decision.
Okay. With permission of the working group, I will move. Hearing what you said and the fact that we had a full discussion under a previous county and kept it as still under consideration, I'd like to suggest that we move that from non-compliant to still under consideration, if that's okay with.
Is that a vote?
What?
Yeah, well, will we make a motion and a vote, or no? We just take it from the working group to move it
If
to
the
that?
working group would like to move it, and you're the chair of the working group, so is it okay with you?
I will, yes.
Okay. So number 3 under Lehigh will be moved from non-compliant to still under consideration. Okay.
Thank you, Senator, for your comments. Number 4, Lehigh project number 4, human impact community thread, 22-11, $30,000. It is recommended for approval. And that concludes my report.
Okay. Moving on to Luzerne County, Secretary.
Luzerne County, program number 1, treatment for incarcerated populations, $568,721. It is recommended for approval.
Thank you. Lycoming County,
Back to me.
okay,
Lycoming project number 1, medication assisted treatment, $36,639.05. It is also recommended for approval. Moving on to
okay,
McKean.
moving on to McCain, and that is, Shay. I'm sorry, yes, Shay.
King County Program number 1, Too Good for Drugs, in the amount of $120,000. We recommended that for approval. King County Program number 2, Educational Materials for School, in the amount of $3,722.22, was recommended for approval. King County Program number 3, Certified Recovery Specialist, in the amount of $53,000, was recommended for approval. King County Program number 4, Funding for Prevention Campaigns, in the amount of $14,024.24, was recommended for approval. McKean County Program number 5, naloxone distribution, in the amount of $30,000. We were requesting more information, still under consideration of the county.
Thank you. With that, we're in an appropriate place to have another resolution. This will be the 8th resolution, and it is resolved. The motion I would like to have moved is that resolved that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Lancaster County Program number 1, Lawrence County Programs numbers 1 and 2, 4 and 5, Lehigh County Programs number 1 and 4, Luzerne County Program number 1, Lycoming County Program number 1, McCain County Programs number 1 to 4. Now I have a motion for that resolution.
Move motion.
Okay, Robert Postal, second. Any discussion?
I would abstain from the Lycoming County.
Shay is abstaining from Lycoming County.
I did not hear a second.
I'll second Kevin.
Further discussion? Observations? Okay, all in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. There's one further resolution with respect to this group, and that is with respect to the fact that the recommendation is that 4 programs of Lawrence County are non-compliant. So I'd like to have a resolution that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby disapproves the following programs as non-compliant with the applicable terms as set forth in Exhibit E, Lawrence County Programs 3 and 6 to 8. And I have a motion to that effect. Moved Jim Gregory, second. Second by Rob Postal. Any discussion? All in favor, please say aye.
Aye.
Opposed? Okay, moving on to Mercer County.
Mercer County autopsy, $24,000. That is still under consideration. Program number 2, MH opioid counseling, $110,000. That was recommended for approval. Program number 3, MAT MOUD program, $120,000 for 100. That was recommended for approval. Mercer, program number 4, LSW consultant, $63,325, still under consideration. Mercer, number 5, program 5, opioid anti-stigma advertisement projects, $78,830. That is still under consideration. Mercer, number 6, media campaign project, $80,000, still under consideration. Mercer, program 7, opioid medical lock boxes and medication disposal bags, $39,000, recommended for approval. Mercer, program 8, sponsor opioid motivational speaker and purchase books, $10,000, still under consideration. Mercer, program 9, sponsor monthly self-care workshops and speakers, $50,000. That one is still under consideration. Mercer Program 10, Operation Endorse Resistance of Substance Abuse Everywhere Program, plus purchase of building and monitor renovation, $101,000. That one is still under consideration. Mercer Program 11, $210,548. Support people in treatment and recovery. That one was still under consideration. Going to move on to Mifflin County.
Yes, please.
Program number 1, crises line digital media, $36,953. That one is still under consideration. Program number 2, medication assisted treatment, $17,231.60, recommended for approval. Program number 3, the reentry services, $3,396.85, still under consideration. Program number 4, stigma reduction, $66,774.65. That is still under consideration. Program number 5, OUD training efforts, $25,759. That one is still under consideration. Program 6, prevention, $10,416, still under consideration. Program 7, recovery support, $8,739, recommended for approval. Program 8, treatment, intervention, and case management services, $66,696. That one was recommended for approval. That concludes my section.
Okay, thank you. I would note if you could look under Mifflin number 5, and one of the reasons we sent that back, and there was a couple others that fell within this. You might note that part of the expenditures were for cost of attendance at a national drug conference. We don't disapprove of that. There is training that is involved with sending people to programs. We encourage people to learn from other states, and there are a number of good national programs, but also we do feel an obligation to make sure there's not an abundance of spending when it is being spent on things like travel and attending out of town seminars, et cetera. And that's one of the reasons we're asking for further consideration under that one. So with that, we can move on to Monroe County.
I'm going to add a little bit more context, just to slightly say that I think that there were just varying opinions about training within our work group. While I am a firm supporter that we need people to be adequately trained, and whether that includes sending them to a national conference or a local conference, those are allowable expenses. So I think at the end of the day, there were folks that were concerned about national travel. That was not a concern for me. So I'll just, for the record.
Good. Yes, I'm not saying that all the working groups were unanimous in their recommendations. Okay, Monroe, Secretary. I'm sorry, that's Shay.
Monroe County Program number 1, Monroe County Fentanyl Awareness Campaign in the amount of $263,467. We recommended approval. Monroe County Program number 2, Support Specialist, did not have a dollar attached to it, but we would recommend approval. That would expand their work handoff.
Okay. Montgomery County, Shay, also.
Montgomery County Program number 1, Prevention Services, $720,957.06, still under consideration. Montgomery County Program number 2, MAT Services, Clinics, Community, $400,000. We recommended for approval. Montgomery County Program number 3, Recovery Housing Supports in the amount of $100,000, still under consideration. Montgomery County Program number 4, County CRS Coordinator and Services in the amount of $106,071.78. We recommended approval. Montgomery County Program number 5, Opioid Coordinator in the amount of $91,593.32. We recommended approval. Montgomery County Program number 6, Crisis Services Mobile and Walk-in the amount of $1,390,000, still under consideration. Montgomery County Program number 7, MAT Services at their county jail in the amount of $718,736.86. We recommended approval. And Montgomery County Program number 8, MPort for in the amount of $750,691.61. Also still under consideration. And I think some of those bigger ticket items, we had questions about percentages and who the money would be used on.
Yes, and I think that was particularly true, if you look at Montgomery number 6, there obviously was a tremendous amount of detail that was there, but we did have a question about exactly what was being treated, what it was being used for, was it all related to opioids? And we are trying to seek whether or not, what percentage of it. It's obviously a big ticket item with being $1.4 million. And we did think that was worthy of getting further information on.
Right,
Okay.
and then we have Montour, program number 1, warm handoff, $59,023.83. That is still under consideration.
Great, thank you. Okay, with that, we will vote and on the counties that we have just reviewed. It is resolution number 9, and it deals with Mercer, Mifflin, Monroe, and Montgomery counties. Result that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby approve the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Mercer County Program 2 and 3, and number 7, Mifflin County Program 2, 7 and 8, Monroe County Programs 1 and 2, and Monroe County Program, Montgomery County Program 2, 4 to 5, and 7. May I have a motion to that effect?
I have a motion.
Oh,
Second.
Senator,
Senator Tartaglione and Robert Postal was a second. Okay, any discussion?
Abstain from,
Okay. Any further discussion? All in favor, please say aye.
Aye.
Opposed? Okay, motion passes. It is just about noon. I don't know what everybody else is doing, but there is some food outside here. I would like to suggest a 10-minute break just to get the food. We can then continue with the meeting. It's an appropriate place because we are going to be moving, and Philadelphia is included in the next group, and obviously a large bulk of the money from the opioid settlement went into Philadelphia. So I want to make sure that we have the adequate opportunity to really go into Philadelphia. So I think it's an appropriate time for a break. Thank you. 10-minute
On audio is now on.
Okay, very good. It is 12:05, so we will get started again. We're on to Northampton County, check.
Okay, Northampton County Program Number 1, the county newsletter in the amount of $21,999.98 is still under consideration. Northampton County Program Number 2, impaired stimulation kits in the amount of $8,772.64 is also still under consideration. Northampton County Program Number 3, Deterra Outreach, in the amount of $390,200 with recommended approval. Northampton County Program Number 4, Fake is Real campaign, in the amount of $234,543.94, still under consideration. Northampton County Program Number 5, Live Well, Be Well, in the amount of $25,101.85, still under consideration. Northampton County Program Number 6, Narcan vending boxes, in the amount of $10,108.18, we recommended approval. And Northampton County Program Number 7, Recovery Centers, in the amount of $244,881.10, still under consideration.
Thank you. Moving on to Northumberland County. Kevin?
Northumberland, project number 1 is one handoff program, $70,942.59. It is recommended for approval. And then we move on to Perry County, which is not mine.
Perry County, program number 1, Perry County Prison Medication Assisted Treatment, $105,000. It is recommended for approval.
Sheriff's Commission, I'll move on to Philadelphia County.
Yep.
Philadelphia project number 1, Housing First Initiative, $4,522,937, and it is recommended for approval. Philadelphia project number 2, expand MOUD access in prison, $1,400,000. It is recommended for approval. Philadelphia project number 3, mobile wound care, $1,360,000. It is also recommended for approval. Philadelphia project number 4, mobile methadone, $1,200,000. It is recommended for approval. Project number 5 for Philadelphia, citywide overdose prevention canvassing, $373,725. It is recommended for approval. Philadelphia project number 6, police assisted diversion, PAD, expansion, $325,000. It is recommended for approval. Project number 7, Philadelphia, alternative response to sustainment, $375,000. It is also recommended for approval. Philadelphia project number 8, overdose prevention and community healing fund, $3,500,000. It's still under consideration at this time. Philadelphia project number 9, Kensington resident support, $7,500,000, still under consideration. That concludes Philadelphia County.
Okay, as you can see with the 2 that are still under consideration, and I did want to give the senator and Jean the opportunity to weigh in. We felt we must get more information. The one being a grant program, the other one just say generally to Kensington resident support. It's a total of $11 million. It is a significant sum of money, and we just have no details as to what it's going to. By way of hearsay and other information, we hear it's going to things that we have problems with, whether or not it be playgrounds or whatever. But we are waiting to get from Philadelphia a full list of exactly what the programs are, so we can go through program by program by program and decide by June 20th We're gonna reconvene the task force to go through that. It was fully discussed by the task force, and we just think that that kind of money and with the lack of information, that we are duty bound to dig much deeper into it. With that, Senator or Dean, would you have any comments you'd like to make to that?
Are they able to unmute?
They can unmute themselves.
No?
I'm sorry.
There you go.
I believe, they went through a nonprofit, the Scattergood Foundation. And the only information we got was that was 27 nonprofits got money. And I'm hearing $100,000 for soccer fields, socks, home repairs. So I have some real concern, and I really do think we need to get all the information, in order to make, whether or not to make a recommendation.
Thank you.
Thank you. Gene, do you want to add anything to it? Okay, hearing none. We will move on to Pike County. And that is Shay.
Pike County Program 1, medically assisted treatment program in the amount of $5,912.47. We recommended approval. Pike County Program number 2, fentanyl awareness campaign in the amount of $98,392. We recommended approval. Questions are, we'll just move right on to Potter.
Okay.
Excuse me, Potter County Program number 1, treatment group in Potter County Jail in the amount of $5,980.58. We recommended approval. Potter County Program number 2, opioid transitional living program in the amount of $31,926.98. We recommended approval. Potter County Program number 3, transportation services in the amount of $4,458.63. We recommended approval. Potter County Program number 4, educational addiction and recovery program materials in the amount of $21,631.82. We recommended approval.
Look at this.
Sorry, guys.
Potter County Program number 5, opioid addiction drug diversion products in the amount of $8,385. We recommended approval. Potter County Program number 6, prevention education in the amount of $7,832.80. We recommend approval. And Potter County Program number 7, professional training in the amount of $21,000. We recommended approval. That's it for Potter.
Mr. Chair, if I may make a comment about Potter, I think it's interesting. This is one of the smaller counties we have in our state. They have 7 projects all approved, small amounts of money, but they're trying to diversify it, and I want to give them credit. They did a good job.
I agree. Thank you.
Schuylkill County, if I may.
Yep.
Schuylkill County project number 1, treatment for incarcerated population, MAT program, $516,692.87. It is recommended for approval. Schuylkill County project number 2, naloxone distribution boxes, $3,086.94, also recommended for approval. Final, Schuylkill County number 3, it is, Recovery Center Drug and Alcohol Crisis Walk-In and Mental Health Crisis Walk-In Center, $471,416. It is a percentage. We looked at that in the group. It is recommended for approval.
Thank you. Okay, with that, we will move on to the resolution. Resolution number 10, which is resolved that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E. Hampton County Program numbers 3 to 6. Northumberland County Program number 1, Perry County Program number 1, Philadelphia County Programs 1 to 7, Pike County Program 1 and 2, Potter County Programs 1 to 7, Schuylkill County Programs 1 to 3. May I have a motion to that effect?
Motion.
So moved. Second?
Second.
Okay. Any abstentions from any of those? Any questions? Discussion? All in favor, please say aye.
Aye.
Opposed? Okay, thank you. Opposed? Okay, moving on to Snyder County.
Snyder County project number 1, inmate drug telehealth assessment, $2,400. It is recommended for approval. Somerset, moving into Somerset County, Somerset project number 1, crisis workforce warm handoff. It is also recommended for approval. It's $100,000. Somerset project number 2, movement outdoors, $30,000. It is still under consideration. That's some additional questions. Somerset project number 3, Uptown Works. They are included AED and naloxone for community events, $2,600. It's still under consideration. Somerset project number 4, recovery walk, $5,000. It is still under consideration at this time.
Yeah.
And that concludes my report.
Okay, thank you. That will take us to Sullivan County. Which is,
That's so many.
Yeah, that's still you. I was confused there for a minute.
Sullivan, project number 1, case manager 2, recovery liaison. It is still under consideration for $64,089.97. Sullivan County, project number 2, too good for drugs, $29,674.34. We are recommending for approval. If I may move into Susquehanna.
please.
Susquehanna project number 1, Susquehanna County Opioid Fund, $68,000. It is recommended for approval. That concludes all of my reports. It'll go down to project number 3.
Okay, now we're on to Tioga County, and that would be Shay.
Okay. Tioga County Program number 1, outpatient services. In the amount of $35,722.55, still under consideration. Tioga County Program number 2, recovery house. In the amount of $71,167.37, also still under consideration. Tioga County Program number 3, school-based counseling services in the amount of $30,000. We would recommend approval. Tioga County Program number 4, youth intervention in the amount of $15,511.18, still under consideration. Tioga County Program number 5, certified recovery services in the amount of $18,000, still under consideration. Tioga County Program number 6, transportation in the amount of $5,000, recommended approval. Tioga County Program number 7, overdose awareness event in the amount of $6,000, still under consideration. Tioga County Program number 8, walk for recovery in the amount of $2,852.15, recommended approval. Tioga County Program number 9, drug endangered children in the amount of $10,166.95, still under consideration. Tioga County Program number 10, overdose fatality review in the amount of $5,000, recommended approval. And Tioga County Program number 11, drug disposal in the amount of $3,420, we recommend approval.
Okay,
If I may, Union County had no project submitted under our group. Under Venango County had project number 1, prison reentry, $346,038.96, still under consideration. And project, group 2. One.
okay. Warren County, And that has none. Washington County Secretary.
Washington County, program number 1. Program implementation and provision of treatment services at Greenbrier Treatment Center, $454,000, 339, still under consideration.
Okay.
Yeah.
Wayne
Wayne County,
Shay.
Wayne County program number 1, prison MAT program in the amount of $48,000. We recommended approval.
What, oh, you have a resolution.
Okay. Resolution dealing with the last several counties we went over. Resolved, the Board of Trustees of the Trust, based on the recommendations of the working group, hereby approves the following programs as compliant with the applicable terms as set forth in Exhibit E. Snyder County Program number 1, Somerset County Programs 1 and 5 to 7, Sullivan County Program number 2, Susquehanna County Program number 1, Tioga County Programs 3, 6, 8, 10 to 11, and Wayne County Program number 1. May I have a motion to that effect?
So move.
Second? Okay. Any discussion? All those in favor, please say aye.
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 Opposed? Okay, we will move on to Westmoreland County.
Westmoreland County, and I'm gonna bring us home because I think the rest are mine, so bear with me, don't fall asleep, stay with me, keep online, don't mute me, ready? Here we go, Westmoreland County, project number 1, Department of Community Relations and Prevention, $325,000, still under consideration. Westmoreland project number 2, Narcan fentanyl, $184,676.76, still under consideration. Westmoreland number 3, social worker, $395,000, still under consideration. Westmoreland County number 4, recovery training and education, $150,000, still under consideration. Westmoreland County project number 5, community recovery expansion, $164,853.26, still under consideration. Westmoreland County DARE program, $162,986.60, still under consideration. Westmoreland County Take Note, $62,832.96, still under consideration. Westmoreland County number 8, community outreach, $155,916.45, still under consideration. Westmoreland County number 9, case management and recovery support services, $134,060.09, still under consideration. Westmoreland County number 10, Gateway, no program named, $577,267 and still under consideration. Westmoreland County project number 11, currently under the county jail, no program name identified, no identifying information, $214,351, still under consideration.
With respect to Westmoreland County, if I could, and not just because it's a neighbor of mine living in Allegheny, but they have been ones that from the beginning have sought a lot of information from the technical advisory group. And it was at the very beginning of us getting the technical advisory group going when we saw that there was going to be a need to get back to the counties who had very sincere interest in seeing whether their programs would work or not. And we were at the very beginning of the program slow in getting back. Westmoreland is one of those counties that we were slow in getting back. Kevin and I have both talked personally to the person in charge of the programs. They know that they're going to be asked to supply additional information. But I can say that Westmoreland intends to supply the further information based upon the information that they have given me thus far. I think we're going to find that most of theirs is in compliance. And I just didn't want everybody to think that because we were putting all of these as still under consideration, that Westmoreland wasn't trying to be very diligent in what they were doing. I think that that they are trying, and they were also one of the programs where they would have sought money for a program that's allowed under Exhibit E, the syringe program. And but Westmoreland County is not allowed by the state to do that. So that's one of the reasons for Westmoreland County having the showing that they have. We can move on to Wyoming County, Kevin.
Thank you, Mr. Chair. Wyoming County project number 1, co-responder program, $51,996, and it is still under consideration. If I may move to York County. York
Can
County.
Hi, this is
Yes.
Secretary Davis Jones. Before you move on, I just have a question since we're in the W's and we're going alphabetical order. Wilkes-Barre Township, are we not reporting anything on them because of the fact that they're a subdivision? I just wanted to make sure because they were in my packet.
We are not going over the litigating subdivisions because
Okay.
under the court order, we currently don't have the
Okay.
right really to say yes or no to them. So
Good
Okay.
question. Thank you, Secretary.
Thank you.
York County. York County project number 1, collective response initiative, $350,000. It is recommended for approval. York County project number 2, first responder training, $15,000. It is recommended for approval. York County project number 3, staff training at TNW, $63,796.69. It is also recommended for approval. York County project number 4, school prevention program, $75,000. It is recommended for approval. York County project number 5, JUMP, JUMP, $164,970.28. It is still under consideration. York County project number 6, prison MAT. It is recommended for approval at $250,000. York County project number 7, ROMPPA prevention project, $200,000. It is still under consideration. York County project number 8, the Advantage program, $25,000. It is recommended for approval. York County project number 9, Reentry Opportunity Center, $28,275.50. It is recommended for approval. York County project number 10, WellSpan, Sublocade, and Care Companion, $29,854.36. It is also recommended for approval. York project number 11, WellSpan, CRS, and hygiene kits, $228,230. It is still under consideration. Final project, York County project number 12, Pathways, CRS, $58,600. It is recommended for approval. Mr. Chairman, that concludes my report.
thank you very much. If I could, I'd like to go back to York County program number 1, which is the York opioid collaborative, for a total of $350,000. This was one of the ones that the group, when we first looked at it, had questions about it, questions concerning whether or not it was appropriate to spend this kind of money on an outside group that was going to be putting together recommendations. It does clearly fall within leadership, planning, and coordination. I will hearken back to the discussion we had about Dauphin County and McNeese, where we had a similar question, albeit for, I believe in that case, it was about 85,000 as opposed to 350. But we had gone back to both Dauphin and to York County to find out exactly what they were spending the money on. York sent in an extensive amount of information concerning what they had spent it on. It is a group of a lot of interested people in the citizens of the community. They're pulling together groups in the community. They're having a lot of leadership sessions. They're involved in making recommendations and then helping with implementing the recommendations that they may have made to the extent that they are funded. They're also serving a little bit as a group that is using opioid money to help get other not-for-profits in the York area involved with giving additional monies in order to support some of the efforts that they have undertaken. Upon balance, after we reviewed it, we had a second meeting of the working group, and the working group did recommend approval of the York program. But I did want to bring it up, Senator Rothman, particularly for you, since you had voiced concerned about the Dauphin County program. I wanted to see if you had any wanted us to look further at the York program. Bjorn?
Yes.
I'm sorry, that's fine. No, I appreciate that. And again, to clarify in Dauphin County, ultimately, I suspect we will approve it. I just asked for more information. So I will always give them the benefit of the doubt. We'll give them the benefit of the doubt, but we'd just like more information from Dauphin County.
Okay, and are you okay with the recommendation that the working group has with respect to York, which is to approve it because they did submit the further information and the working group looked at it?
Yes, if the working group's comfortable with it, I'm fine.
Okay, thank you. Okay, any other discussion of York County? Okay, final resolution that we have in regard to this is solely with regard to York County. Resolved that the Board of Trustees of the Trust, based on the recommendations of the working groups, hereby approves the following program as compliant with the applicable settlement terms as set forth in Exhibit E. York County programs numbers 1 to 4, number 6, numbers 8 to 10, and number 12. And I have a resolution to that effect. Jim Gregory, yes. Any second?
Second.
Robert Postal, any discussion? All in favor, please say aye.
Aye.
Opposed? Okay. Well, we are finished with going through 370 projects. I appreciate it. In large measure, it was because of the extensive work that was done by the working groups. As I said, each of the 3 working groups met for 5 hours or more. And that's in addition to the extensive amount of work that the working groups put in reviewing all of the material even before they came in. I was very impressed. Although I wasn't a formal member of any of the working groups, having sat through all of them, I can tell you they were all prepared. They had read all the information. They were quick with the questions and erred, I believe, on getting additional information as opposed to just approving. I'm glad to see that that the full trust in looking at all this and looking at the recommendations of the working groups concur with their judgments in great measure. And I look forward to going on to the next steps of the process, which will be number 1, notifying the counties that the programs that were approved. As I said, it's about 55% of the total number of programs that were submitted were approved here today. There's a little bit of tweak, so I might be a percentage point or so off. As you can see, a tremendous number are going back for further consideration, which will require additional working of the working groups. But we are going to go back and let the counties know exactly what we need by way of further information. The CCAP and our attorneys have already worked on the kind of information we're going to be seeking from them. So I'll ask Jason to review exactly the information we're going to go back, and the counties will know by certainly early next week, if not by the end of day tomorrow, what programs have been approved and which ones we're seeking further information. The counties will also know which ones we have rejected.
Thanks, Tom. Yeah, so we don't have a final document yet. We're still collaborating with Penn State and CCAP to finalize it. We want follow-up information, which is essentially data similar to what was submitted on March 15 to come through the reporting tool or through Penn State. This is additional data that they also want to collect and that the trust needs in order to make decisions on programs still under consideration. So the idea is a single document will go out to counties identifying the remediation programs that were approved at today's meeting of the Board of Trustees. It will include the program number and the program name and possibly additional information such as funds spent and committed. The second category will be those under consideration. What we found through the working group process is that the follow-up, the follow-up questions that the working groups had for those programs still under consideration essentially fell into three major categories. One was the extent to which the program was related to opioid remediation. Sometimes that wasn't clear. You heard that during the discussion on the programs. Sometimes additional details were needed to understand more about the program to determine compliance with Exhibit E. And sometimes supporting documentation was desired because if there were program notes, they didn't tell the working group enough, or maybe there weren't program notes or attachments. So for some programs, additional documents are being sought. There will also be an other sort of catch-all category in the event that there is a specific question unique to a particular program. And that information, which of those questions applies, and if there's a unique question, what it is, will be communicated to each county with respect to each program still under consideration. Those counties will be given a reasonable but relatively short deadline within which to provide that information so that the working groups can reconvene with the goal of making recommendations to the Board of Trustees at its public meeting on June 20. This communication will also include some language about future plans. The reporting tool asked counties to identify future plans, but didn't really collect very much information about them because frankly, the trust doesn't really have much to say about future plans, and future plans means different things to different people, but we wanted them to get thinking about how they're going to spend the money in the future, and including programs they might identify in a future report as a current remediation program. So they will be encouraged to provide sufficient detail when those plans do mature to that level.
I will say, though, that with respect to the future plans, several counties were very good about submitting what the future plans were. They wanted it with the admonition that they're not ready for prime time. They are not ready to be discussed because the commissioners, in fact, had not reviewed them and approved them. To the extent we can, we're honoring that confidentiality because they were not finally approved. But to the extent that they want to submit the future plans and get an initial feel as to where we're going to come out on, we're happy to provide that that advice to the county. So I would encourage you to submit I would encourage them to submit future plans if they like, but we certainly recognize that they don't come with the approval of the county commissioners yet, and we're not holding them to those future plans. The other thing I would say is once we get the information in, the working groups that requested the information will in fact meet again and go over the additional information to see what the recommendation will be for the June 20th meeting. I'm anticipating that the great bulk of the programs that are being sent back for future consideration, the information will be provided and they will be recommended for approval down the line. But in the meantime, if any of you, in listening to the discussion today, whether or not you were part of a particular working group, if a particular program struck your fancy that you looked at, are wondering about, was sent down for future consideration, and they're going to be providing additional information, just let us know. And regardless of what working group you are in, we will provide you with that information so that you can get fully up to speed before you cast your final vote at the June 20th meeting. And if you want to file something in writing with the chair of the working group, I'm sure that they would appreciate any additional input you may have based upon that additional information. I would suspect that you're not all gonna want information about every one of the 140 programs that went back for further consideration, but I'm anticipating also that there are some, such as what is Philadelphia doing with its $11 million? Might want to seek additional clarification on exactly what programs it is being spent on. So that is what the future plans will be. I don't think we need any vote on it going forward. Going back to the agenda, I believe we're up to any other business. Oh, no.
The explanation, I'm sorry, the list of extended.
Do we have that?
We sure do.
Okay. We are going to show everybody the list of counties that have requested extensions. It's the bulk of the counties. Just so you know, I go back to the beginning of the meeting where I pointed out the counties were not even required to submit, and with or without extension, they have until June 30th to spend, or June 15th of this year to spend the money or commit to spend the money that was sent out in December of 2022. They also have until approximately June of 2025 to spend or commit to spending the money that was sent out in December. So the mere fact that they're asking for extensions on this, most of it is dealing with not the bulk of the money. They already had additional time to be able to do it. When these extensions, which we automatically granted, are finished, I can tell you that we are going to require much more detail from counties as to why they didn't spend the money. We want to encourage the counties, particularly now that they have other counties' experiences to draw on. They see the kind of programs that are out there, the kind of programs, and I know that in working with CCAP yesterday and seeing all the counties get together, have their sidebars about what's working, what isn't working, I can already see counties drawing upon other counties' experiences. So I would anticipate that they will be able to commit to spending the money much more quickly going forward. And we really do want to see the money get out there being spent and committed as quickly as possible. It's a terrible, terrible addiction, terrible problem that the state and the country are going through. And we would like to see this money utilized as quickly as possible in the right way to try to remedy the situation we find ourselves in. So with that, do we have the counties are those the counties?
They sure are.
Okay. Will we be posting this to the website also?
Sure.
We will also post this to the website with the additional information. So these are the counties that have that requested the extension, and you see there how much money they have remaining to be spent from the payments 1 and 2. As I said, the payment number 3, which was made in December of 2023, does not have to be spent until June of 2025. So people did not have to ask for an extension. So these are the counties, and all of these extensions have been granted.
Can I add something, Mr. Chairman?
Yes.
And I don't know the specific counties that can't do the original. There are counties that have not been or committed, and I think that's an important term, committed.
Yes.
Many with significant or relatively significant percentages not committed yet. As you said, it's not meant to be in a bank account. It's meant to be used. I'm wondering what kind of communication, or should we send the communication to some of those counties that, for lack of a better term, seem to be behind. Now, I think your point is good. A lot of counties here yesterday that exchanged notes and talked about the different programs, and I do think that's going to accelerate a decision from the county commissioner. But I do remember going through some of the working groups pointing out, or pointing out that some counties seem to be.
Yeah, so let me explain. In working with Penn State Council CCAP and Mayor Dussel, the document that Jason referred to earlier, that we are sending notification out to the counties regarding their remediation programs. In the very top of that document, it will also outline the payments that they have received and what they've spent so far and how much time they have to spend the rest of those funds or request an extension. So that will be kind of the summary of the document, and then it will then go through each of the programs.
And in addition to that, we will send out a communication and start dealing with counties individually as to the importance of getting off their tail and getting busy spending the money. I will use my executive prerogative to say that we will be doing that and we don't need a vote on that. Any other discussion on that? Hearing none, any new business?
Some from the more of a good of the order, from the symposium. First of all, I want to say thank you for setting that up and doing such a wonderful job and getting people here. I am curious to know which counties were represented and which ones. I think that would be important for the trust to see where our outreach has to go, especially if it's in consideration of unexpended funds. The second part of that is a couple questions came up that I could not answer, and I felt it worthy to bring to the trust to even consider not to vote on or do anything. But one of the considerations that came up was on a county audit, what rules apply to these funds? So I'm not an auditor, so I couldn't answer the question, but they're talking about 4,300 regs or human services. If they have, like, what rules are our auditors to look at? I don't know that answer. Mardusel, I would assume would probably give a good solution to that, but I think it needs to be published or even put into the letter goes out, because I think that there were several counties that kind of asked that question. So I wanted to put that out there. The second piece that came up
On that one, before we
Yes,
move off from that one, I would say, I don't have the answer to exactly what the auditors have to go through. We will talk to Mardusel. We will get information out to the counties on that. We won't include it in this initial thing that's going out because I do anticipate it's going to take Mardusel and others a week or so at least to come up with an answer. And I don't want to delay the follow-up going out to the counties.
Lisa's giving you a head nod, so I believe that she's in agreement. She's on. There you go.
Okay, good.
Thank you.
In addition to that, I had another question. After the secretary reported out about state funding and how they were expending it, one of the items they used it for was for loan forgiveness program. And so I had several counties come up and say, can we give loan forgiveness with our trust fund to our drug and alcohol counselors because of recruitment and retention? So I know it's not in the formal ask of a question, and perhaps I can direct them back to that. And I'm not asking for an answer today. I just want to put it on your plate because it's going to come up. And so I don't know what the piece of Exhibit E that falls under. I'm not here to judge it. I'm just asking the question because I had two counties come up and ask that question specifically. Keeping that in mind.
May I speak on that as well? We're losing a number of rehabs. They're closing the drug and alcohol. We lost one again today in Lehigh. So as the overdose continues, we have programs because they can't pay their employees under the ASAM alignments, and they're closing down. We should try to be helping them stay open if we can. I don't know what we can do to help that process along.
Secretary, would you like to speak to it since it was your presentation yesterday that led to the questions?
Sorry, I wasn't there for the presentation.
Yeah, I'm on mute. I will just say that our goal is to support the SUD workforce. And while you all saw the presentation, I think it should be noted that we have several sources in which we are using opioid settlement funds, programs, and we have received multiple opioid settlement funds outside of the big four. So there is McKinsey. We also have used additional funds that we receive from the medical marijuana fund as well to support student loan repayment. So just to be clear, yes, we've used opioid settlement funds, but understanding that there are multiple funds and funds that are outside of the big four and the wave 2 funds, to be clear.
Thank you.
If you can let me
Other
know,
comment, Senator.
I'm sorry, Madam Secretary, if you can just let me know the other programs that are out there. I'd like to supply it to the drug and alcohol providers. So hopefully we don't lose any other people. I'm sorry I didn't.
And I'll make sure I understand, Senator, I'll follow up with you to make sure that I'm understanding your request.
Thank you, Madam Secretary.
Other trustees want to weigh in? Before anybody does, I think what I would say is I find this falling a little bit into the category of the naloxone that we were talking about. If funds are available from another source, I would urge the counties to try to take advantage of those funds and the programs the state already has in effect in order to do student loan reductions, forgiveness, whatever it may be, before the counties would use their funds to do it. So I think it may well be something, particularly if the state's doing it, that may be necessary. I can see how it can support it and would fall in under Exhibit E, but I think we have to approach it with care because I do think there's a number of other student forgiveness programs that are available in order to make that happen without using these programs. Kevin.
And just to be certain that we did take that into account before awarding, anyone that already had an existing student loan repayment obligation in which they were involved in, they were not included in any of our in the eligibility requirement. So
Thank you.
I guess my concern comes, you can give student loan forgiveness to students, but you have drug and alcohol programs closing. And they are people who they fit into the ASAM alignment, they're doing everything they're supposed to, but they just can't make it. So I just want to put that on the record.
Kevin, did you have anything else?
That was my 2 comments from the symposium. Thank
Okay.
you.
thank you.
Any other new business? Or for the good of the order question? Okay, hearing none, meeting is adjourned. Thank you all very much for your time. And I think you can anticipate at the next meeting, which will be June 20th, that it will be at least as long as this meeting was. And hopefully everybody will be as well prepared as they were for this meeting so that we can move forward with due deliberation. Thank you very much.
Thank you.